of the public, and it's a representative, the representation of the community, of what the people want. So that is one of our best practices. We make sure that every legislation, like when we were doing the Counter Domestic Violence Act of 2022, for instance, we went out to the community and the bill was translated into our vernacular so that we could be able to communicate even to the people who are in the remotest part of the country, for them to understand the provisions of the law and what is there, for them to understand that they can always access the law in terms of addressing the issues that concern them. Thank you.
Thank you very much. Representation, legislation by consultation. We really appreciate that great lesson. And I believe it's something that can be applicable in any country to improve the program and also to ensure that we continue to strengthen our roles as parliaments. I saw Zambia.
We'll come. We're trying to open the documents.
Oh, okay.
Yeah, we'll come in later.
Mozambique.
Go ahead. Please go ahead.
Bom dia. Com a permissão de Sua Excelência Secretária-Geral, senhores diretores e colegas, vou desde já partilhar aquilo que é a experiência de Moçambique em relação a SRHR. Brasil, que em relação...
Momento, espera.
Bom dia mais uma vez, com permissão de Sua Excelência, Senhora Secretária-Geral, senhores diretores e colegas, passo desde já a partilhar a experiência de Moçambique em relação à STSR. Então, em relação ao primeiro objetivo, ou o primeiro tema, o Parlamento deve aprovar a legislação em prol da educação sexual abrangente e o direito à informação. Também deve divulgar e fiscalizar a sua implementação. Por outro lado, a educação sexual e reprodutiva em Moçambique, antes das primeiras eleições, a população não tinha esses direitos humanos. Então, foi com a participação de Moçambique na Conferência de Cairo de 1994 e de Beijing em 1995 que marcaram o início ao reconhecimento dos direitos sexuais e reprodutivos como direitos humanos e recomendaram a elaboração de políticas públicas específicas e a introdução desta temática nas demais políticas públicas, como é o caso de políticas públicas educativas, através do Plano Estratégico de Educação Sexual e Reprodutiva, que passou a ser um programa no ensino secundário geral. Importa salientar também que é o dever do Parlamento promover debate nos seus ciclos eleitorais. Sim. Mas, muito obrigado. Sim. Então, dizia que é dever do Parlamento promover debates nos seus círculos eleitorais com a sociedade civil, também sensibilizar os jovens marginalizados e a população-chave. Então, em relação àquilo que é a promoção à educação sexual abrangente e direitos à informação. Em relação ao tema 2, a Assembleia da República tem competências de eleger os membros da Comissão Nacional para os Direitos Humanos e também deve garantir a fiscalização da promoção da responsabilidade democrática e progressão dos direitos humanos, né, tendo em conta promover as parcerias com a sociedade civil para a promoção e proteção dos direitos humanos através de mesas redondas, conferências, palestras, workshops que promovam acesso à justiça e entre outras atividades. Em relação ao tema 3, em Moçambique existem políticas para a proteção de população-chave e grupos marginalizados. Os parlamentos devem garantir a divulgação das leis que protejam a população-chave e grupos marginalizados junto às comunidades. Em relação ao tema 4, os parlamentares, na fase da aprovação do orçamento e do plano econômico e social, devem assegurar a construção de mais hospitais para garantir o acesso universal da saúde. Também o armazenamento e distribuição dos produtos de SDSR. Em Moçambique também existe iniciativa presidencial, um distrito, um hospital, com o objetivo de massificar o acesso universal à saúde. Em relação ao tema 5, é da praxe, a nossa Constituição consagra a igualdade de direitos e é papel do Parlamento garantir o cumprimento da mesma através da fiscalização dos diferentes autores. O Parlamento aprovou a Lei contra a Violência Doméstica e para sua fiscalização em todo o país existem postos policiais que atendem questões específicas sobre a violência doméstica. Nos locais onde não existem, essas unidades são integradas nos postos policiais gerais. Também importa realçar que na aprovação do orçamento, os parlamentos devem garantir a incorporação de ações ligadas contra as alterações climáticas, por forma a garantir a igualdade de direitos. Indo já para o último tema, que é o tema 6, em Moçambique existe a lei de prevenção e combate às uniões prematuras, que prevê a eliminação de uniões maritais envolvendo pessoas com menores de 18 anos, que essas pessoas, quando prevaricam, são punidos com penas de 12 e são multados até 2 anos, caso seja um adulto que case ou se junta com uma menor ou com uma criança. Também importa referir que os parlamentos devem fazer campanhas de sensibilização nos seus círculos eleitorais com as comunidades e líderes comunitários. Por outro lado, os parlamentares devem promover a mobilização social, o acesso à educação de qualidade e a retenção escolar através de lanches escolares e empoderamento das raparigas. E muito obrigado pela atenção dispensada.
Obrigado. Thank you, Mozambique, for the great lessons and for sharing the best practices. I believe we may have 1 or 2 questions for Mozambique. Let us give Mozambique an opportunity. We didn't ask Lesotho anything. I believe they were clear. So let's ask 1 or 2 questions for Mozambique, if any. Or you wanted to present Okay, no, that's fine. No questions, just lessons learned from Mozambique. Thank you very much. Mozambique has engaged in dialogues and community engagement, and parliaments have also really consulted with the communities on specific legislation. Mozambique has also pushed for domestication of international commitments related to SRHR, in particular ICPD, the Beijing Declaration and its platform for action, among others, and Mozambique has also facilitated capacity building of parliamentarians on human rights. And I think this is something that we should also consider, if not yet done so, particularly in as far as SRHR is concerned. Collaboration with CSO and other partners, very key. We could learn from that as well. Laws in Mozambique have been enacted to protect the rights of marginalized and key populations. And as we know, Mozambique has got some of the progressive laws. And he was saying that even pursuing effective implementation of such laws. And the role of Parliament is very critical in that regard, and that is a very powerful lesson. Budget approvals for hospitals, construction, and commodities, even in districts, very good. Yesterday, that presentation on commodities, although it was very long and very technical, I think it's something that we should really pursue in terms of really seeing how best we can improve and strengthen efforts around commodities availability, including strengthening the supply chains, and most importantly, just ensuring that our citizens actually have, the drugs, they have the choice, and are able to use such. Constitution has really embedded GBV, very good, and I believe GBV prevention efforts are implemented effectively in that regard. He mentioned quite a number of initiatives around GBV prevention, including training of police, among others, and I'll not mention all of them. And budget allocation for climate change, very important. I think parliaments can push for that. As we heard from the presentations yesterday, climate change has got very strong interlinkages with SRHR and the health of citizens in general. And lastly, on prevention of early marriages. So thank you, Mozambique. I'll give an opportunity to the next country to share, one or two best practices, or if you have detailed experiences from all the thematic areas, go ahead. I see Swaziland, and then after Swaziland.
Thank you very much, Madam Facilitator. A good morning to Madam SJ and my colleagues. I'll just be on theme 6, where Parliament has conducted sensitization sessions with parliamentarians on eradication of early child marriage model law. And this was mainstreamed within the gender-based model laws in adherence to promoting legal reform and strengthened programming with strengthened tabling of motions and questions and answer session to this effect. Such incidents were resulted in the mainstreaming of all issues touching on the girl child and young women with respect to early child marriage, GBV, as well as in action, it was done through parliamentary or sessional committees, as well as the children's gender, climate, as well as the DPM's portfolio committees. That is where it was mainstreamed. I'll also look into issues whereby how was this affected by conducting dialogues with youth clubs, by also consultation with traditional and religious leaders, staging of virtual meetings with SRHR champions, as well as compiling shared WhatsApp package messages to make alerts on such critical issues of early child marriages, as well as GBV messages. Also, foster care regulations are in place to leverage the abuse of orphanages, as well as establishment of shelter homes for survivors. We also have reviewed legislative frameworks in place with reference to the above, which include the SODV Act of 2018, where a contentious clauses has been amended to in this regard. And we also have enforcement of such relevant laws, which includes the National Children Policy of 2009, the Education Sector Policy, the Child Protecting Act of 2012, as well as we have in place an ongoing amendment of the Marriage Act with respect to customary Marriage Act. And also all this is done in consultation with the Human Rights Commission, because it all traverses towards human rights issues. We've had the launch of the National Gender Policy, whereby it was such a milestone for the country because it embraced issues of high violence, issues of positive parent strategy, issues of promoting STEM, as well as empowerment of young women and girls in trade, which meant more financial institutions were in now to support women in terms of business entrepreneurship, as well as women in elections. Issues on gender responsive budgeting has been executed through capacity building initiative amongst members of parliament. And we've also have population policy framework highly reviewed, which was stating as far back as 2002. This was a call to effect more on issues of contentious clauses on the SODV Act, because it redressed the demographic demographic dividend with respect to age consent and more. Also reviewed the legislative framework on human rights. We have the law reform unit, which is there now to help with obsolete laws, as well as to review more femicide and SRHR femicide laws. Now, I think I can end there and highly note that there's been more issues also on education retention policy, as well as issues to provide medication or mitigation on early and unintended pregnancies and forceful marriages. Otherwise, there's a lot. Thank you so much.
Clearly, there's a lot. Thank you so much for the lessons, for the best practices, and for the learnings from Swaziland. We truly appreciate the work involved, sensitization of communities. MPs are also very busy working on the model laws and mainstreaming of issues related to the girl child and other SRHR related issues. And the role of the portfolio committee is also very outstanding there, a very big lesson for other countries. Dialogues with youth clubs, very critical. And I really appreciated the innovation part. I think the use of WhatsApp, the use of other innovative approaches to communicate GBV messages and to reach out to more populations using innovation is something that we can also learn from. Building of shelters and also building the capacity of parliamentarians to champion for protection in as far as GBV is concerned. And the rest of the lessons really cut across reviewing of the legal frameworks, amendment of laws, launching of policies that speak very strongly to SRHR, gender responsive budgeting, and I also think other countries can learn a lot from the population policy, which is really an SRHR policy that speaks to the demographic dividends and strengthening the role of young people in development. So thank you so much, Swaziland. We have learned a lot, and thank you. Angola?
Bom dia a todos, bom dia, colegas. Em Angola nós temos algumas práticas consideradas bem vistas, mas eu só gostaria de destacar uma ou duas. A primeira tem a ver com a feitoria de leis. Em Angola parte sempre do pressuposto que a lei deve ter 3 critérios. O primeiro, a lei deve ser inclusiva. O segundo, a lei deve prevenir um certo comportamento. E o terceiro, a lei deve censurar ou acabar ou desmotivar com um certo tipo de comportamento. A quando da efeitoria da lei é sempre criada uma comissão multissetorial onde fazem parte vários elementos do estrato social da sociedade e essa comissão setorial tem a obrigatoriedade de fazer uma escutação pública, ou seja, de ouvir todos os estratos sociais da sociedade com o objetivo de tornar o projeto de lei mais robusto. Isso é muito interessante porque permite a inclusão dos cidadãos, porque entendemos nós que aquelas matérias que afetam diretamente a vida dos cidadãos, se eles mesmos puderem fazer parte, pode ser acolhida da melhor maneira possível. Então, a título de exemplo, nós temos 3 exemplos, né, de 3 leis muito importantes que afetam diretamente a saúde sexual e reprodutiva. Esse ano, por exemplo, no dia 30 de abril, deu-se por início, digamos assim, a revisão de uma lei que já tem 20 anos, a lei do HIV-Sida, onde nesse momento está a ser proposta, não é, a sua própria revisão. Há 2 anos para cá, reviu-se uma outra lei de extrema importância, que é o Código Penal, e por força de um recurso extraordinário, devido a algumas sugestões de grupos da sociedade civil, essa lei está a ser revista em alguns pontos ainda nesse presente ano. Também tivemos, por exemplo, a lei do vandalismo público, que foi uma lei muito inclusiva, ouviu-se muito extrato da sociedade. Então, resumindo, né, essa é uma boa prática que nós consideramos que existe em Angola, que toda lei deve ser inclusiva, ou seja, deve envolver todos os estratos da sociedade. E eu fico por aqui.
Thank you very much, Angola, for sharing such good practices around lawmaking. And we also noted that Angola Parliament ensured meaningful engagement of citizens through consultations across the country, including in the rural areas. We also have appreciated the approach. That's a very key lesson, using a multi-sectoral approach that works around the review of laws to ensure that every sector is well represented within such committees, including health and SRHR. And yes, so mainly the examples that he gave also recently in Angola, SRHR law was reviewed, and also a penal code related to SRHR was reviewed. So thank you very much, Angola. Great lessons, and I believe in line with the mandate of parliaments for oversight, for legislation, for representation, for budgeting, very important to continue to reflect on that, and also to reflect on the priorities of the project to see how best you can position your program to effectively implement this important project. Is there any other country that is ready? Malawi, I see you. I'll come to you to note you, and after Malawi, I'll give a chance to him, and then an opportunity to Zimbabwe.
Thank you so much. One of the best practice in Malawi that we have noted is the establishment of the technical working group. We all know that for members of parliament to function properly, they have to be equipped with very important information regarding the thematic areas that we are discussing here. So members of parliament or Parliament of Malawi has managed to constitute a technical working group with different technocrats around the thematic areas that are able to provide the programmatic as well as technical guidance. So it's a best practice that enabled Parliament to roll out the project without much difficulties. So the other best practice that we have noted under promotion for promoting access to safe abortion is the legislative function of Parliament, whereby we saw our members of Parliament formulating a task force to drive the abortion law reform agenda. And members of Parliament also were able to engage with different community leaders as well as religious leaders so that they also support the abortion law reform. And it was the first of its kind whereby we saw the abortion bill or the motion appearing on the order paper, and it went to Parliament, though it didn't go through. But this was a great milestone. And the other best practice that we have noted is on the in terms of on ensuring commodity security in the context of universal health coverage. We have seen members of Parliament playing their budgetary role, whereby they were able to lobby for budget increase towards family planning commodities. So we have seen a progressive increase. Since 2019, we have seen a progressive increase in budget allocation towards family planning. The other area that we have seen is on ending child marriages. Members of Parliament also, they have put a lot of effort in terms of ending child marriages. And we have seen members of Parliament amending the Penal Code, Penal Code Amendment Act of 2023, whereby the age of consent to marriage was also raised from 16 years to 18 years. And also we have seen members of Parliament amending the Child Protection and Justice Act that standardizes the age of consent also to 18 years. Thank you so much.
Thank you, Malawi, for that clear presentation, and the lessons have been well noted. For the sake of time, I'll now proceed to another country. Let me not summarize. I believe we learned a lot from Malawi as well. DRC.
Merci beaucoup. Et nous allons essayer d'être brefs. Nous allons répondre aux questions sur les thèmes qui nous ont été proposés. Pour le premier thème, promouvoir l'éducation complète à la sexualité et le droit à l'information. Sur ce point, au niveau de la République du Congo, la loi sur l'éducation nationale a déjà été votée. Et avant d'ailleurs l'installation de ce projet, moi j'ai participé à l'examen de la loi sur l'éducation. Et à cette époque, on avait inscrit l'éducation complète sexuelle dans le programme scolaire, mais cela n'a jamais été donné. Et tout juste dernièrement, j'ai participé à un atelier qui a été organisé par le ministre sortant, Tony Mwaba, sur l'inscription du programme de l'éducation sexuelle complète au niveau de l'école secondaire. Et les dossiers évoluent. Et je pense qu'effectivement, si le programme est approuvé, les parlementaires pourront en faire une large diffusion. Et la loi sur le programme et les contenus à dispenser pourra être votée. Et cette loi, d'ailleurs, doit être uniforme sur tout le territoire national pour inclure effectivement les jeunes qui sont en dehors du système éducatif régulier. Et chez nous, il y a l'école publique et il y a les jeunes gens qui ne sont pas dans le cycle normal, mais qui sont rattrapés dans des cours en dehors de cercles réguliers. Ce sont ceux-là qu'on peut prendre en compte. Pour le deuxième thème, promouvoir la responsabilité démocratique et faire progresser les droits humains, nous pensons que cela pourra contribuer à la lutte contre le détournement et le détournement des deniers publics et la lutte contre la corruption et contre toutes sortes de violences des droits de l'homme. À partir du moment où on a combattu la corruption et on a combattu le détournement des deniers publics, nous pensons que c'est une responsabilité démocratique et aussi si on combat toutes les violations des droits humains. Alors, il y a eu, les parlementaires peuvent organiser les ateliers et chez nous, à l'habitude, si les parlementaires organisent les ateliers, ils invitent la population civile pour exprimer leurs préoccupations auxquelles les parlementaires peuvent répondre soit par le vote de loi ou soit par des recommandations au gouvernement. Pour le troisième thème, protéger les populations clés et les groupes marginalisés. C'est là le grand problème à la RDC, comme la présidente a dit hier. Donc, les parlementaires devront d'abord avoir les arguments convaincants pour leur acceptation par la population qui est très hostile à leur égard. Donc, au niveau de la RDC, effectivement, la population clé a des sérieux problèmes. Donc, si il y a des politiciens qui sont, par exemple, appelés des gays, mais qui ne s'affichent pas, qui se cachent, dès lors qu'un gay se présente au public au niveau de la RDC, moins de 10 minutes, je pense qu'il peut déjà se trouver dans la mort. Donc ça, c'est un problème qui est très sérieux au niveau de la République du Congo. Il faudrait que les parlementaires puissent user de leurs prérogatives peut-être pour d'abord convaincre la population, pour accepter cette population-là et tourner vers le gouvernement. Sans cela, la situation n'est pas encore acceptée au niveau de la RDC. Et pour les personnes vivant avec le VIH, l'acceptation est tacite. Les parlementaires sont déjà conscientisés, mais c'est qu'il faut plutôt lutter contre la stigmatisation et la discrimination. Alors, les parlementaires peuvent aussi favoriser l'accès aux services et ils ne s'y opposent pas. Donc, ils peuvent, après sensibilisation menée, d'ailleurs, pour les personnes marginalisées, il y a déjà certaines cliniques au niveau de Kinshasa dans lesquelles ces gens-là se font soigner. Pour le quatrième thème, assurer la sécurité et l'approvisionnement dans le contexte d'une couverture sanitaire universelle. Là, le chef de l'État était déjà champion de ça. Et d'ailleurs, le Parlement a l'habitude de convoquer le ministre de la Santé pour l'examen du budget, pour augmenter la part qui est réservée aux produits de santé. Et c'est que nous devons recommander aux parlementaires pour qu'ils puissent aller vérifier si la grande part du budget n'est pas allée dans d'autres rubriques. Et le Parlement peut aussi lancer les parlementaires sur le terrain pour les suivre et vérifier et contrôler si les produits ont atteint la destination et leur cible. C'est ça ce qui est pour la couverture sanitaire universelle. Pour le 5e thème, promouvoir l'égalité entre les sexes dans le cadre de lutte contre les changements climatiques et éliminer les violences basées sur les genres. Le Parlement peut voter une loi sur les changements climatiques qui protège l'écosystème dans son ensemble, et cela pour éviter d'exacerber les violences basées sur les genres. Le Parlement devra aussi veiller à voter la loi pour lutter contre la pauvreté et en poussant le gouvernement à s'investir dans le programme tendant à octroyer l'autonomisation de la femme, surtout rurale, et la création d'emplois pour les jeunes gens. Puisqu'au niveau de Kinshasa, par exemple, il y a les jeunes gens qui sont dans la rue. Je sais, si vous savez, il y a un phénomène Kuluna chez nous, où les jeunes gens avec des machettes peuvent attaquer les citoyens libres. Et surtout, un groupe de Wewa, ce sont des conducteurs de motos qui parfois s'attaquent même à la police. Ils sont des gens qui ne sont pas faciles à gérer. Donc, il faudrait que le gouvernement songe à la création d'emplois pour encadrer les jeunes gens et donner les moyens conséquents pour la protection de l'environnement. Le Parlement devra aussi voter un budget conséquent pour permettre l'autonomisation de la femme et la protection de l'environnement. Tout cela pourra atténuer les violences faites aux genres. C'est ce que les tâches auxquelles nous allons nous atteler auprès des parlementaires. Pour le 6e thème, éliminer le mariage d'enfants et les grossesses précoces et non désirées. C'est là, la loi a déjà été votée au niveau de la République démocratique du Congo. Les parlementaires devaient seulement veiller à l'application de cette loi, car elle est déjà votée, et faire un suivi rigoureux. Alors, les parlementaires devraient aussi, lors de leurs vacances parlementaires, sensibiliser dans le cadre de mariage d'enfants et de grossesse non désirée, d'abord convaincre les chefs religieux, puis les communautés sur les conséquences et les dangers que représente ce fléau, et amener à accepter la loi à la matière, car elle existe déjà. Au niveau de la République démocratique du Congo, l'avortement sécurisé pose encore des problèmes et les chefs religieux s'y opposent, même si c'est le cas de viol. Donc il faudrait que les parlementaires puissent user de leurs prérogatives pour d'abord convaincre les chefs religieux, puisque 80% de la population au niveau de la RDC est chrétienne. Et tous les dimanches, les boutiques, pharmacies sont fermées, les gens peuvent aller à l'église pour rentrer vers 14 h. Donc, ce sont des faiseurs de foi. Ils lavent, ce sont des gens qui font le lavage psychologique. Il faudrait que les parlementaires puissent d'abord s'intéresser aux chefs religieux et après convaincre les communautés en expliquant les conséquences de viol. Et enfin, les parlementaires devraient travailler en collaboration avec les organismes internationaux, les organisations non gouvernementales internationales et locales qui disposent de données vérifiables sur le sujet. Puisque la RDC, les problèmes de violence, c'est vraiment très grave, surtout dans les zones de conflit armé. Je dis et je vous remercie.
Thank you very much, DRC, for sharing your experiences and also for sharing your plans for the future, which is really good. DRC raised something very concerning, which other groups have not raised. I think we should point it out. Issues related to strong discrimination against LGBTIs and also even stigma against people with HIV. So I think it's very important to consider relevant or appropriate measures to tackle this in line with the project. Very critical that DRC and other countries consider capacity building of parliamentarians. I think it's important to start with building their capacity, awareness raising for them, so that even as they try to grapple with the issues, or even as they attempt or try to assist on these issues that they are also struggling with, we build their capacity. So that will be really helpful. Research and more research. Research is important. Evidence-based data can be used to convince or at least to campaign for change, for transformation. So more and more research is really, really advisable. I don't know if there's anything that colleagues want to speak to, particularly to assist DRC around the issues of human rights, issues related to LGBTI, if you have had any experiences around that, that your parliaments have tackled and that the advice you can give. However, remember that all these best practices are going to be consolidated and compiled. They'll be shared with all of you, and there'll be an opportunity for cross-fertilization of information. Okay, DRC, thank you very much. Where did I write? Who's next? Zimbabwe. After Zimbabwe, it will be Namibia.
Good morning, SG. Good morning, our moderator. Thank you very much for giving us this opportunity to also speak about our best practices in Zimbabwe. Under the first topic, which is promoting comprehensive sexuality education and the right to information, we have as Parliament an oversight role to ensure the effective implementation of the following policies. The first policy is the Zimbabwe School Health Policy, and this provides a frame of reference to guide the implementation of a number of health-related issues in regards to the welfare of learners, and these include the needs of learners with disabilities, mental health, sexual reproductive health concerns, among others. Then also we have we ensure that guidance and counseling is examined at all levels in the schools. Then we also have the junior parliamentary platform where the youths come together and discuss matters affecting them, as well as advocating for the rights of young people in Zimbabwe. Then under promoting democratic accountability and advancing human rights, we also have various commissions, and the Parliament has the power to list, select, interview, and recommend commissioners. And under the commissions, we have Zimbabwe Media Commission, we have the Zimbabwe Human Rights Commission, and the Zimbabwe Gender Commission. And these institutions are vital in promoting democracy, human rights, and good governance. And they are entrusted with a significant responsibility that include signing of memorandums, and also establishing formal partnerships. Then in regard to protecting key population and the marginalized groups, the Parliament also ensures that it engages on evidence-based research on marginalized groups, then also facilitates public consultations, and we also have technical working groups, and these amplify the voices of the marginalized. And these technical working groups also work as consultants and assist the SRHR researchers with information. We also use the community and national radio stations to disseminate information on SRHR as well as climate justice, just to try and protect the key populations and the marginalized groups. And also we take advantage of the exhibition shows to disseminate information to protect these populations. Then under ensuring commodity security in the context of universal coverage, we have several taxes. Then that includes sugar tax, and this goes to cancer treatment. And we also have health levy, that is from airtime. We also have tobacco tax. The other name of this one is the sin tax. And so whenever one takes something that is harmful, they will be also contributing to to the finances that are going to go into the consolidated fund so that it will assist in improving the health system. Then we also have the Health Resilient Fund, and this one assists the vulnerable groups, and it comes from a pool of donors. Then the Parliament also ensures retention of these funds by the Ministry of Health and Child Care. Then under promoting gender equality and climate action and eliminating gender-based violence, this is what we do.
Good morning, everyone. Let me just take it from there. As the Parliament of Zimbabwe, we have a new committee it's a thematic committee on climate change, and it specifically conducts oversight role on government policies, the disaster risk reduction, climate change adaptation, and mitigation policies and programs being undertaken by the government, among other areas. And we also have the Gender Action Plan, which works on addressing climate change vulnerabilities and advancing knowledge and understanding of gender responsive climate action. The Parliament is also going to consider the climate change bill very soon, and it seeks to regulate technologies, including strengthening appropriate institutions and funding mechanisms for climate action. And on the last theme, we have eliminating child marriages and early unintended pregnancies. We have the Marriages Act of 2022, which outlaws child marriages by ensuring the age of marriage is over 18 years. We also have the recent one, the Criminal Laws Amendment. This is the Protection of Children and Young Persons, Acts of 2024, September, age of sexual contact above 18. The question remains the age of consent and the access to SRHR by adolescents, like we said yesterday, because our age of consent is 18, and we don't know if the age of consent will work in hand with the SRHR, since we're saying they need to get access to some of these things. We also have the Medical Services Amendment Bill, which will have public consultation starting from next week. And we also have the campaigns by the Child Rights Caucus and Youth Caucus. Thank you.
Thank you, Zimbabwe, for such inspiring best practices. I believe that we have all learned from that. I think something that is a highlight and different from others is the partnerships with commissions. Very critical, and I think it's something that other countries can learn from, bearing in mind that the commissions have the expertise around human rights, around GBV, around gender equality, around climate action. It's something that can really benefit the parliaments, and I think that is a very interesting approach. And of course, your work on research related to LGBTI, I think that's a powerful lesson that can also be learned by others. Another unique approach by Zimbabwe is working or advocating, parliaments advocating for taxes to support commodity security. Very interesting. I think most parliaments can be more active in that area. As we heard from the presentation yesterday, commodity security continues to be an issue due to several problems, including resource mobilization. So that's a very interesting approach. And thematic working groups, very interesting. I think technical working groups are very instrumental on the work that you're doing as parliaments in relation to this program. Technical committees can really strengthen the capacity of parliaments. They can strengthen the capacity of researchers. They can really play a very instrumental role. So just to say, I think it's another lesson that required to be highlighted accordingly. Thank you, Zimbabwe. As we proceed to the next country, I saw Namibia.
Good morning, colleagues. Thank you for the opportunity. I will present on discussions that we had as the Namibian researchers. As a group of new researchers to the project, we looked at these themes hypothetically and also on new innovative ways we can maybe find to support work that has already been done and that is already work in progress. I will touch on the first theme, which is promoting comprehensive sexuality education, CSE and the right of information, on how parliaments can champion innovative legislation to integrate CSE into schools, curriculums, and community settings. the discussion around that was that the Namibian Parliament could mandate and integration of CSE into the national school curriculum with a strong focus on rural and marginalized communities by leveraging technology. For example, parliaments could pass legislation promoting digital literature programs that combine CSE content with e-learning platforms. This could be supported by mobile CSE education units equipped with tablets and internet access that visit rural schools and community centers, ensuring even the most isolated communities benefit from the same knowledge as those in the urban areas. And all of this is also supported by the Access to Information Act that was passed this year. Looking at what legislative tools government parliaments create to ensure CSE programs are inclusive and of marginalized youth and key populations, parliaments could establish CSE Inclusivity Fund, dedication to supporting the development of customized CSE materials, and such as the Braille CSE textbooks for visually impaired students and sign language integrated CSE video content for hearing impaired youth. The legislation could also require that the schools and community programs adhere to inclusivity standards and that educational professionals receive training to address the unique needs of the marginalized populations. Looking a bit on theme 2, which is promoting democratic accountability and advancing human rights, on innovative ways that parliament actions can be taken to enhance accountability in governance and safeguarding human rights. The Namibian Parliament could launch a transparency and civic engagement portal, an online platform that tracks the actions and voting records of parliamentarians and enables citizens to submit concerns and feedback directly to their elected officials. This could be complemented by the Office of the Ombudsman in collaboration with a relevant parliamentary and partner with civil society and independent media to monitor and investigate human rights abuses, which holds government institutions accountable in real time through public hearings and policy recommendations. And how can Parliament strengthen partnerships with civil society and media to advance democratic accountability within national frameworks? The Parliament could initiate a nationwide civic dialogue series, bringing together civil society organizations, media representatives, and traditional leaders to engage in structured discussions about governance and accountability. These dialogues could be televised, ensuring that they reach a wide audience and provide transparency. Additionally, parliaments could establish formal advisory councils composed of civil society and traditional authorities to influence legislative priorities and ensure that these stakeholders have a direct role in shaping accountability measures. We also looked at the other thematic areas, but I will stop there for now. Thank you.
Thank you very much, Namibia, much appreciated. And bearing in mind that parliaments are at different levels of implementation, I think you have come up with very interesting and innovative approaches for tackling the thematic areas. And we are looking forward to the application of these ideas in Namibia. I believe other countries have also learned a lot from these suggestions, that are quite innovative. E-learning to ensure that you reach the furthest of the furthest, citizens in the country. SDSC Inclusivity Fund, very innovative. Materials development around CSE, particularly using Braille as well. Training and capacity building of teachers and parents, very, very creative. We also learned that there could be a launching of an online platform for accountability that parliamentarians can actually use to follow through on accountability for the implementation of existing laws on SRHR. Partnerships and more partnerships. A unique one is coming out here. Partnership with Ombudsman. very important for accountability. Yes, I thought I should highlight those and really thank you, Namibia. Zambia, are you ready? Who else is ready?
Yes, we are ready. Okay, cheers.
We haven't.
For you, it will be Zambia, no problem. Go ahead.
Thank you. Good morning, everyone. I won't go very much in detail into the different slides, but sort of a summary to each and every thematic area that we are to assign to attend to. One of the things that we have been doing, and it's a new innovation that is coming in, is to have members of parliament as champions of the different issues. For instance, we now have a champion on issues of LGBTQI, and we have a champion on GBV, we have a champion on human rights, and we kind of target members of parliament who have experience and sometimes even technical know-how in terms of those key issues. For instance, with the LGBTQI, we targeted an MP who has children who are already into the LGBTQI, who has transformed and everything else that's involved in that. The other thing that we do, which is a new thing altogether, that is looks like it's becoming fashionable in the Parliament of Lesotho, is to have private members' bills in order to assist MPs in terms of our post-legislative processes. Members are coming in with amendments to the existing bills, existing acts of Parliament. And some of which, for the longest, were acts that were not very much implementable in our country. I want to highlight one of an act of Parliament, the Computer Crime Cyber Security Act of Lesotho 2022, that showed a different dimension in terms of the key populations of Lesotho. In Lesotho, we are really silent in terms of key population. There's legal frameworks that do protect them, but we don't kill them. As the case of DRC and other cases, we really don't care, I guess. But they are not protected legally, and therefore they have some other issues in terms of societal belonging. So what has been key in terms of this act was inclusion of LGBTQI people in an act, and it created a lot of petitions to Parliament from religious and traditionalists. And it's very important because now we engaged in terms of the debate between the hard rules and the soft rules. More often than not, in any society, the soft rules supersedes the hard rules. So the hard rule was, no, we have an act that protects you. But actually in the society, it's something different. This touches again on issues of child marriages. Traditionalists are the ones who are perpetuating child marriages in our country. And it's important to integrate them as we are working towards eradicating child marriage. The last one I wish to attend to is what was initiated in 2021 that has not seen the light, but it's in the process, is to have offices of, we have a bicameral system, and our first chamber is composed mostly by principal chiefs. So the idea was to have gender-based violence offices in the offices of the principal chief. The reason being, those are the offices that people go to at first in the village level. and therefore they report to their principal chiefs, and as such, it can be structured from the lower level like that. The last one, but not least, is now we have secured a column with one of the local newspapers for SRH issues to ensure the right of information dissemination, especially for our rural areas and the older people who are not so conversant with Facebook, Twitter, and the rest. And as such, they are able to get the right information because the issues of SRH touches a lot of societal fabric. And as such, it is important to touch the different stages and ages in our societies. I thank you.
Thank you very much, Lesotho, for the lessons, the best practices from the Kingdom of Lesotho. What I picked, what is really very interesting that could also be learned by others is the use of traditional leader structures, very critical, especially to address social norms that are harmful, social gender practices that are harmful, such as child marriages. Very, very important. So the dialogues and the engagements by parliaments with the traditional leaders, very, very critical. Thank you for sharing that. So institutionalization, very important, as G spoke to that yesterday, to strengthen institutions by way of placing human resources on GBV in the different offices. You said in the offices of the chiefs? Yes, I thought that was another innovative approach that other parliaments can consider to advocate for, and also to ensure that mechanisms are strengthened at all levels to ensure that gender equality is achieved. Media use of media. I think often we take it for granted and we don't intensify it enough. As part of this program, use of media is very, very important. And SADC PF emphasized yesterday that there's actually a budget available that can be utilized to strengthen our efforts around media. So this is an approach, this is a practice that can actually be strengthened by all of us, by all the countries in the room. So thank you very much, Lesotho. We've learned a lot. I like the vernacular, use of vernacular in the newspapers. Yes. Namibia, do you want to ask a question to Lesotho, or you want to add something? Over to you, ma.
Yeah, no, thank you very much, Madam Moderator. It's not to Lesotho. It is a contribution on what Zimbabwe has reported. Zimbabwe reported that they have a challenge in terms of the age of consent, which is 18 years. I just wanted to share that in Namibia, we have, in terms of the Child Care Protection Act, different ages for different purposes. For example, the age of majority is 18. But in terms of getting married, you have to be 21 years old. The age of consent in terms of sex is 16. The age of accessing medical services is 14, which include sexual reproductive health issues. So I think it is important that we look at the particular issue and that it is regulated in terms of legislation, because it needs to be considerate of the maturity of the child as well. And with the new movement of us advocating for CSE, it is important that we regulate that. I just wanted to share that.
Thank you for raising that. It's a very, very important issue. I was in Zimbabwe when this issue was actually being debated. The struggle is real because there are so many inconsistencies in the different pieces of legislation, not only in Namibia and Zimbabwe, but across the region or across the continent. So very important to position our parliaments to actually, address and advocate for the harmonization, but most importantly, advocate for the laws that will really protect our children. Our parliamentarians need to be educated. We need to do research. We need to really consolidate information that we can use and equip our MPs with to be able to advocate with research and more research around even giving evidence from other countries, you know, how it worked in this country and why this can also work in Namibia or in Zimbabwe. So thank you for raising that. It's an ongoing problem. And I think working with our Attorney General's chambers is always a challenge because they don't see things the way we see them as activists or as ministers of gender or as ministers of youth sometimes. So there's not always a consensus amongst the stakeholders. So very, very important topic that requires ongoing engagements at all levels, including the traditional leaders, civil society organizations who can go on radio, who can really publish this in newspapers, who can disseminate information on social media to really sensitize communities and assist us to get our parliaments to adopt appropriate laws to protect our children and to ensure access of SRHR services for our young people and adolescents. Thank you very much. Our partnerships with development partners. I remember in Botswana when this issue was on the table, UNICEF played a very instrumental role, and UNICEF worked very closely with Parliament, worked very closely with other UN agencies, but also worked very closely with traditional leaders. So I think it requires a lot of partnership across board. Yeah. Okay, any burning issue on this very concerning topic? Otherwise, I'll give an opportunity to Zambia. I know they have been ready for a while. Over to you, Zambia.
Thank you very much, and good morning, everyone. I hope you had a restful evening. As a way of introduction, I'd like to state that from our project document, we know the sphere of operation of the Member of Parliament and the functions of Parliament. So our responses are tailored to what parliamentarians are legally mandated to do. That is to make laws, to approve budgets, to represent their people, and oversight over the executive. So on the first thematic area on promoting comprehensive sexuality education, I'll not spend a lot of time here because you recall yesterday my colleague said quite a lot about what we have done and we are doing, especially after the resistance we saw in 2021. But suffice to state that after that, the members of Parliament and other stakeholders, UNESCO, yesterday we heard, has been instrumental in this area, developed an advocacy strategy. And that advocacy strategy on CSE is being used, you know, as a tool to sustain engagement with different stakeholders, especially at constituency level. So individual members of Parliament who have been engaging traditional leaders, faith-based organizations, teachers and health workers at constituency level especially. And they use community radio stations in their constituencies, and they have been involved to carry the message, especially on special days, like for example, Youth Day, Independence Day, Women's Day. So they will engage the community through maybe football, a netball game, and they use that as a platform to speak to the issues of sexuality education in the schools. And I move on to the next question on the legislative tools that parliaments can use to ensure CSE. And like I said, I will not dwell so much on this one, but I think that we all know that we refer to best practice from other countries. We refer to model laws and regional and international commitments. For example, the ESTA commitments. Those are the tools that parliamentarians can use to inform their interventions. Promoting democratic accountability and advancing human rights, that was the second thematic area. And the question asked there was, what innovative parliamentary actions can be taken to enhance accountability in governance and safeguard human rights? So our response is that in our case, there's been deliberate participation of citizens in parliamentary oversight processes, mainly through committees of parliament. Our committees do have an opportunity when they go out to conduct public hearings, and as a project, we have worked with a number of them. So through these approaches, members of parliament are able to get information from the citizens themselves about which areas or which human rights are being violated. And the beauty about working through committee system is that at the end of all these processes, like public hearings, committees generate reports, and these reports contain recommendations which are presented on the floor of the House. And once they go on the floor of the House, then the government or the executive is prompted to respond or to take actions. And there is a continuous process through which government assurances are tracked. And in our system, we have what we call action taken reports. So these are given every year by the executive, informing the parliament on what action is being taken to achieve what was recommended. So we as a project, we also want to leverage on that, and we want to hold some outreach programs where members of parliament can go on the ground and interact with different marginalized groups to appreciate the human rights violations that may be taking place. And we have recognized persons with disabilities vis-a-vis their access to HIV services, and we are actively planning this. And because sometimes they are failing to access medications at the local clinics due to the condition in which they find themselves in. So the members of parliament are being prepped to have an engagement very soon with associations, organizations that work with persons with disabilities. The next question here says, how can parliament strengthen partnerships with civil society and media to advance democratic accountability within national frameworks? One of the ways we suggest is obviously signing memorandum of understanding. We heard a few days ago about how our parliamentary budget office has signed the memorandum of understanding to leverage on think tanks in the area of budgeting. And we want to tag on that one when we start with our sector budget analysis, which focuses on issues of gender inequality and so forth. And apart from that, we have a national working group like any other parliament implementing the project, where we've got vast networks, so many networks in different thematic areas. And our partners are basically just a phone call away when we need information. For example, you remember during the CSE backlash, it was the national working group, the CSOs there and other experts that were instrumental in providing data to the researchers and then to the members of parliament. The third issue is protecting key population and marginalized groups. I've already touched a little bit on the marginalized groups, but on the area of key populations, Zambia perhaps is the only SADC country which has a preamble to the constitution which states that Zambia is a Christian country. And particularly support to LGBT community has been or is a very thorny subject, like my brother highlighted from the DRC, because opposition is anchored in religious, cultural, and even political undertones. So it makes work for the parliamentarians themselves to stand on a platform and speak to these things, because it may jeopardize a vote for them, to come back to parliament. However, there's been engagement through the National AIDS Council and the Ministry of Health itself. So in terms of access to sexual reproductive services for the LGBT community, information from these two institutions is that health practitioners sort of pay a blind eye in terms of who is accessing them. They give the services regardless of who has come, as long as you are a Zambian citizen and you want a service. So that is the information we have. But in the recent past, we've been directly engaging with partners, and one of them being the I in the LGBTQI, the intersect. Now, intersect in the Zambian context, in fact, the members of parliament themselves are of the view that they should not fall within the LGBTQI, because the intersex people, these are people who are born, maybe physiologically, they have genitalia which may identify with both sides. So we have an association that has come on board, and members of parliament were taken through a very detailed training and understood the challenges that this particular group of people faced, because that is how they were born. So, and I think that for this one, it's slightly different from the LGBTQ community. I think that's all I can say on this particular one. The fourth one on commodity security in the context of universal health coverage is that I think in the past there was a baseline that was done, and following from that, the project was very instrumental when two particular bills were presented to Parliament. One on the national health insurance, and the second one on it's called the Zambia Medicines and Medical Supplies bill, or they are now acts of parliament. They were passed in 2018, but implementation started in 2019, and members of parliament were very instrumental. So through these two acts of parliament, we have seen the introduction of the National Health Insurance Management Authority, which is an institution basically that is implementing the National Health Insurance Scheme. And after it came into existence, parliamentarians have been involved in its assessment in terms of its reaching to the societies. And I recall working with a committee of parliament. We went around the country in hospitals, in rural health centers, to see the benefit. And a report was rendered with recommendations to government. But on the whole, it has gone a long way in helping people access health, especially people at the grassroots. People are able to access health now because of the National Health Insurance Scheme. And the ZAMSA Act, the one on medicines and medical supplies, has decentralized the procurement of medicines. Previously, it used to be centrally done at the Ministry of Health, and it created problems. The country is vast. You can't procure in the capital city for people who are hundreds, 200 kilometers away. So when this act was passed, this institution was created, and it is responsible for procurement of medicines and distribution as well. So they have got satellite depots in different parts of the country to ease distribution of medicines to the rural parts of the country. There are a lot of problems. Recently, this institution was in trouble, issues of corruption, it was in the media. But on the whole, it's working well, and there is oversight, obviously, from Parliament, because both these institutions do render annual reports to the Committee on Health. Finally, we move on to promoting gender equality in climate action and eliminating gender-based violence. This is an addition to the thematic areas under the project, and we are excited. And what we have done so far is that we've already started working with, we have a caucus in the National Assembly of Zambia on climate change. We are working with them, and we've also incorporated we've formed what I would call a sub-technical working group. Ourselves as researchers, the caucus on climate change, and we've identified government ministries that work in the area of climate change. There are quite a number, but maybe I could mention 3 or 4 of them. Ministry of Green Economy, Energy, Gender Division, Agriculture, Lands and Natural Resources, Water Development, and so forth. So this sub-technical working group was basically brought together with CSOs to brainstorm on what actionable points MPs would come to. So the next stage is that we'll be having a roundtable meeting where members of Parliament will now be in attendance, so that we can present a document which they can use then to frame their interventions in terms of advocacy or legal policy intervention. So it's very exciting that this aspect has been added. And in addition, in connection with the last thematic area on eliminating child marriage, because we established that climate change impacts these things on child marriage and so forth. So what we intend to do now is to take the Member of Parliament on the ground through a community engagement. And we've already identified some traditional leaders that are doing tremendous work. And we were connected also by the Secretary General when she was in Zambia in August to Plan International, an organization which has done quite a lot of work in this area. So we have this partnership where we will actually be going to a rural community with members of Parliament to see so they can see for themselves what is happening, what climate change has done with regard to GBV, early or unintended pregnancies, and so forth. I could go on and on, there's a lot, but I think I'll end there. And thank you very much for your attention.
Thank you very much, Zambia. So much to learn from Zambia. Very innovative approaches that you have used, and emphasizing a lot on the role of our parliaments around oversight, and also strengthening their capacity, representation, strengthening partnerships, budgets, and so on. So thank you so much. One highlight, or a few highlights from Zambia: putting together MOU, so memorandums of agreement with think tanks. That's a very powerful approach. I think we can also learn from that, particularly around technical issues such as gender budgeting, budget analysis, and so on and so forth. It's also interesting what Zambia is doing on CSCs. The advocacy strategy is in place. Therefore, Zambia parliaments, together with partners, know exactly how to shape this advocacy agenda and oversight around advocating for CSE and to sustain engagements accordingly. So very, very interesting approach as well. Zambia also continues to emphasize on implementation of model laws, implementation of ESCA commitments, and really planning around that to ensure that parliaments are focused on implementation of commitments around that. Public hearings like Lesotho, I think that's another lessons that we can pick from Zambia. Strengthened meaningful engagements of citizens and utilization of technical committees. Very, very important. And the role of committees clearly has to be very, very well defined. And Zambia says the committees prepare reports that they actually hand over to parliamentarians for action. So the recommendations that committees put together inform parliamentarians and also update on progress made. There's a lot. Even yesterday, we learned a lot from Zambia, and I have no doubt that the consolidation of these best practices by SADC PF that will be shared with all of us after this meeting will really, really be helpful for all of us as we continue to strengthen our efforts in ensuring effective implementation of this project. I don't know which country is remaining. Is it Madagascar? That should be the last one. And then after this, we are now getting into presentations. UNDP is ready to make a presentation on marginalized groups and key populations. Is that Madagascar? Yes, thank you, Madagascar. Let's make it short and thank you so much.
Merci beaucoup de m'avoir donné la parole. Donc, pour le cas de Madagascar, en ce qui concerne le premier thématique, comment les parlements peuvent-ils promouvoir une législation novatrice pour l'éducation complète à la sexualité? Donc, à Madagascar, le Parlement pourrait organiser un renforcement de capacité pour les parlementaires. Tout d'abord, on devrait faire ce renforcement de capacité afin d'obtenir un consensus et un soutien en faveur de l'éducation sexuelle complète. Comme nous le savons, nous avons de nouveaux parlementaires. On pourrait aussi réviser et renforcer le document de référence nationale. Madagascar a déjà un document de référence nationale sur l'éducation complète à la sexualité, mais il faut que ce document soit vraiment inclusif et qu'il atteigne surtout les groupes de jeunes marginalisés. Le Parlement aussi pourrait promouvoir une approche intersectorielle, donc un partenariat entre le ministère de l'Éducation, de la Jeunesse, de la Santé et les organisations de la société civile pour renforcer l'intégration de l'éducation sexuelle complète dans les milieux communautaires, donc dans les milieux scolaires. On pourrait aussi adopter une loi spécifique sur l'éducation à la santé reproductive et sexuelle, une loi qui sera un cadre légal pour l'introduction systématique de l'ECS. Donc, cette loi pourrait aussi inclure des clauses relatives à la formation continue des enseignants sur ces sujets. Le Parlement pourrait aussi soutenir des politiques de financement dédiées, donc une part de budget de l'éducation de la jeunesse et de la santé spécifiquement allouée à l'éducation complète de la sexualité. Il peut organiser des actions de sensibilisation aussi par le biais de dialogue communautaire et organiser un débat télévisé. En ce qui concerne le deuxième thématique à Madagascar, les mesures parlementaires suivantes peuvent être envisagées. Tout d'abord, on pourrait renforcer le contrôle parlementaire en collaboration avec la troisième questeur chargée de la bonne gouvernance et de la transparence et avec la commission juridique pour tout ce qui est question de gouvernance, en mettant un accent particulier sur la protection des droits humains. Nous sommes vraiment très honorés parce que les députés sont vraiment impliqués en tout ce qui concerne la SRHR et les droits humains. On peut aussi encourager des mécanismes de plainte accessibles à tous les citoyens pour signaler des abus des droits humains. Donc, nous avons déjà un réseau parlementaire national pour la justice reproductive qui pourrait être un organe indépendant de suivi des droits humains et de gestion des plaintes en coopération avec la société civile. Pour la deuxième thématique encore, Nous sommes en train de promouvoir des droits environnementaux spécifiques pour les jeunes, garantissant ainsi leur protection contre les impacts du changement climatique, en particulier en termes de sécurité alimentaire, accès à l'eau potable et à l'éducation. Okay, pour la troisième thématique, donc, nous avons le même problème que la République démocratique du Congo et de Zambie, donc on ne peut pas parler de LGBT. Mais on peut amender la loi sur la VIH-Sida en soulignant la lutte contre toute forme de stigmatisation, discrimination dans les services publics ou bien dans la communauté. On peut aussi appuyer la politique de réduction des risques en adoptant des lois qui permettent la distribution gratuite de seringues pour les utilisateurs de drogues injectables. Et ainsi, nous sommes en train de l'introduction de la substitution à la méthadone pour la réduction des risques dans la lutte contre le sida. On peut aussi collaborer avec les OSC et les groupes communautaires pour mieux comprendre les besoins spécifiques des populations clés et inclure les perspectives dans le débat parlementaire, assurant ainsi que les lois reflètent la réalité des populations clés. Pour la quatrième thématique, donc, le Parlement de Madagascar peut jouer un rôle crucial en adoptant une politique de vente autour des cliniques mobiles. Ils peuvent appuyer la politique d'amélioration de l'accès aux services de santé dans les zones rurales et les zones isolées par le biais des cliniques mobiles en offrant des soins préventifs, curatifs, notamment santé sexuelle et reproductive. On peut aussi instaurer un suivi parlementaire sur le budget de santé en exigeant que chaque loi de finances prévoit une allocation budgétaire pour l'achat et la distribution de produits relatifs à la SRHR. Il peut y avoir des contrôles réguliers pour évaluer les dépenses. Donc, on peut aussi financer des services de prévention et des soins adaptés aux besoins des adolescents, notamment en réponse aux impacts de changement climatique.
Sorry, you are requested to slow down and also as advised, you can just mention one point under each theme. Remember, we are going to consolidate all the approaches and SADC PF will share the best practices. You don't have to speak to everything, then we can hand over to UNDP. 1 minute. Thank you.
OK. Pour la cinquième thématique, sur la lutte contre la VBG, donc, on pourrait renforcer la législation existante pour lutter, on pourrait appuyer déjà l'accélération de la ratification du protocole de Maputo et nous sommes en train de mettre en place une commission pour la ratification de ce protocole. Et on peut aussi appuyer les programmes existants de résilience climatique spécifiquement pour les femmes en garantissant l'accès à la terre, à l'eau et à d'autres ressources naturelles. Il y a déjà la politique égalité femmes-hommes qu'on pourrait appuyer.
Per theme, 1 point per theme. It's okay. We understand.
Oui, et pour l'élaboration de mariage d'enfants, nous pouvons déjà promouvoir des dialogues entre les parlementaires, les chefs religieux et les communautés afin de s'assurer que les réformes législatives respectant les normes culturelles tout en protégeant surtout les droits des filles. Et enfin, nous avons déjà une législation existante contre le mariage d'enfants, mais nous pourrons améliorer, amender cette loi pour lutter contre le mariage traditionnel en se référant à la loi type de la SADC. Je vous remercie.
Thank you so much, Madagascar, and sincere apologies for rushing you. We're trying to manage time, but so many great lessons from Madagascar. As you can hear, they have a piece of legislation to prevent child marriages, so much to learn, funding policies also in place, as well as a lot of advocacy work by parliamentarians. Thank you so much. May I kindly request that all the countries share their presentations with Rachel from SADC PF Secretariat so that the best practices can be consolidated and shared with all of us. I believe we'll be able to really learn from one another, improve efficiencies, from the lessons we've learned from each other, increase innovation and adapt our programs accordingly, picking from the lessons, and most importantly, we will be able to continue to strengthen the quality for the implementation of our program. So let's give a round of applause to all the countries for the excellent presentations and amazing lessons. You are doing a lot of great work. Be encouraged, and don't forget to take each other's contacts after this so that you can also continue to compare notes as you seek to implement this regional program effectively in your country. At this point in time, I have the opportunity to invite UNDP Regional Office colleagues who are going to share with us on the thematic area on protecting key populations and marginalized groups. We have in our midst Mesfin Getahun, UNDP Policy Advisor and HIV Specialist, and Monica Tabengwa, UNDP Policy Specialist. They're going to do a combined presentation, and I'll give them 15 minutes, and a few minutes remaining will be for Q&A. Over to you, colleagues, and thank you so much.
Next. This one. Okay. Good morning, everyone. I hope you would give us a little bit more than 15 minutes for the presentation. It will be presented by myself and my colleague. My name is Mesfin Getahun. I am a policy advisor on HIV and health in the UNDP regional office based in Pretoria. My colleague, Monica, will introduce herself when it is her turn to make a presentation. So we are going to be presenting, making a presentation on protecting key populations and marginalized groups. The outline of the presentation is going to be that we will a very brief introduction on the We Belong Africa program, through which UNDP supports the kinds of initiatives by SADC-PF and other by SADC-PF and other regional bodies and member states. And then we will introduce a parliamentarian handbook that was developed by UNDP and the SADC Parliamentary Forum Minimum Standards that was developed by the SADC PF Secretariat with support from Sweden, UNDP and UNFPA. So very quickly, We Belong Africa is a UNDP regional program which was developed in 2019 with participation from several partners from government, civil society, and development partners to look into issues of inclusion of marginalized groups, including LGBTI people and key populations. The goal is essentially to support state entities in sub-Saharan Africa to become increasingly accountable to, inclusive of, and responsive to their entire populations, including LGBTI people and other key populations. And this in turn is expected to contribute to better laws, more responsive public sector services, and social norms that affirm the perspective, needs, and rights of sexual and gender minorities. It has three objectives. We intend to support the increasing number of African decision makers who are responsive to, inclusive of, and accountable to LGBTI and key populations. increased capacity of LGBTI and key population activists and allies, and increased inclusion, participation, representation, influence of diverse LGBTI and key populations and their allies. So this is basically We Belong Africa. It is implemented in several African countries, including several SADC member states. It is composed of two major projects called the Inclusive Governance Initiative and the inclusion of young key populations in the SADC region. I will proceed directly to my section of the presentation. I will pass the section that will be presented by my colleague Monica for a better flow of the the presentation. So I will just start with introducing the minimum standards for the protection of the sexual and reproductive health of key populations in the SADC region. So as I mentioned at the beginning, this is actually a tool that was developed in 2019 by the SADC Parliamentary Forum, as I mentioned, with support from Sweden, UNDP, and technical and financial support from Sweden, UNDP, and UNFPA. Quickly to remind the process, I don't know how many of you are already aware of this minimum standard. It was done in 2019. It was based on the decision from the SADC Parliamentary Forum plenary session. So following the decision, a situation analysis and background research was undertaken. Based on that situation analysis, a consultation workshop was conducted in Pretoria in August 2019. And in September and October, the minimum standard development took place. A review and validation meeting was undertaken in Maputo in November 2019, and subsequently it was approved by SADC Parliamentary Forum. So there were a few key messages that informed this minimum standard from the situation analysis that was conducted. So one of them is that preventing new HIV infections and its related diseases remains a critical component of SADC's effort to meet regional and global goals. Stigma and discrimination and violence against key populations remain endemic across the region. Of course, the situation has improved since because the minimum standard was developed in 2019. However, this still remains one of the major challenges. Another finding from the situation analysis was that despite the growing recognition of these issues, including by the SADC Parliamentary Forum, not enough change is occurring at the time. Of course, after 5 years, it is important now for us to come back and revisit where we are. However, the other assessments that we have undertaken through other channels indicates that the situation still requires very concerted effort and engagement from SADC Parliamentary Forum and the parliamentarians through their respective parliaments. We have noticed from the situation analysis that much of the work to bring about change is led by civil society. So one of the reasons for producing the minimum standard was to bring on board engagement of state structures and processes, including parliaments. And then we have said parliamentarians have yet to fulfill their potential. And again, I would like to think that there has been progress since 2019, but it is the role of parliamentarians still remains very valid for the SRHR and HIV of key populations. So the purpose and scope of the minimum standard is basically to guide and support parliamentarians to catalyze change, to define essential requirements and opportunities for improving protections, and clarify essential obligations for member states while accepting range of country contexts. At the end of the presentation, basically this presentation will be shared with you, where we have embedded a link to the minimum standard, and it's a detailed minimum standard. So I will not be going into the whole detail of the minimum standard. We will just basically sharing with you the essential requirements and opportunities under 4 major areas. That would be stigma and discrimination, violence, access to services, and laws and policies. These are the guiding prime principles. I don't think I would need to go through them all, and I'm sure you can have a look at it. And while you go through the minimum standards, you will get more information around the guiding principles. So the first area identified in the minimum standard is reducing stigma and discrimination. And these are essentially the justification or the rationale behind why reducing stigma and discrimination is one major area of focus for parliamentarians in their work to protect the SRHR and HIV-related rights of key populations. So basically, because it is a constitutional protection that are applied equally without discrimination, and healthcare workers should be aware of or accountable for professionalism and ethics, issues of privacy and confidentiality, the need to make healthcare complaints mechanisms accessible, and the need to engage traditional leaders in preventing stigma and discrimination. So based on this, the minimum standards proposes a list of opportunities. So you can consider this as the entry points for parliamentarians in respective work. As you can see, it does not prescribe specific actions. Instead, it outlines the main opportunities that you have. Because it is a regional document, it does not go into the details of each what needs to happen in each country. And obviously, because countries are at different levels and they make different progress in different areas, it will not be realistic to identify each of the entry points for countries. However, the list that I am going to share under those 4 thematic areas will are expected to apply for all countries. Or for most countries. So parliamentarians have the opportunity to monitor and advocate for fair application of constitution. They should call for increased capacity and greater accountability for national human rights commissions. In the presentation this morning, I have heard from a number of countries, at least specifically from one country, where they have engaged in Zimbabwe, I think, national human rights commissions and other commissions. And this is an important area that you can, all countries and parliaments can consider. They need to be advocates for change. They have work to protect populations in their constituencies, support constituencies to use healthcare complaints processes, and forge partnership with local leaders. The second thematic area is ending violence. And under ending violence, the guiding, the main guiding principles are there should be equal application of constitutional protections. There is a need for equal application of criminal laws regarding physical and sexual assault. There needs to be strong oversight and accountability for law enforcement. There is a need for laws and processes to address hate speech. I think this is this hate speech happens especially in media, both traditional mainstream media and social media. So there is a lot of role. Then there is a need for stronger legislation, policy, and procedure to address and prevent sexual violence against key populations. Sexual violence happens at all key populations in our countries. So what are the opportunities in terms of ending violence? There is a need to raise awareness and generate public support for stronger measures to protect everyone. So, and then there is a need for participation in police oversight or law enforcement oversight bodies to champion change. There is a need to work in constituencies to establish partnerships, key population networks, police, healthcare workers, etc. And there is a need to propose new or amended laws to strengthen protections. The third area is monitoring and reforming laws. As the main prevailing legal challenge is the laws which criminalize consensual sexual contact between adults, which eventually need to be amended or repealed. However, this is a long-term work, and parliamentarians need to really engage in a sustainable manner. And we understand that parliamentarians may change, depending on elections. So there we need to have some kind of, institutionalizing this within the parliaments, so that work started in under a certain parliament is sustained in subsequent parliaments. Laws addressing drug use, these are things that can kind of more readily can be changed in countries where drug use is the main driving factor for HIV, especially. Then the protective provisions against discrimination, addressing different types of public education interventions, that we have to make sure that we are putting in place improved knowledge about laws in communities. So the communities need to know about the laws. And the opportunities are a reflection of the situation, basically, that is indicated above. So parliamentarians need to advocate through legislative committees for urgent review of criminal laws where they are applicable. There is a need to propose new or amended laws for greater protection. This is really important in countries where there is no clear protection of key populations. There is a need to call to attention member states' obligations to protect the human rights and health of all individuals. And then we have to ensure that national human rights institutions receive adequate financial and technical support. The last theme is ensuring access to information and services. So policies and plans we have to make sure that policies and plans are in place to ensure that services are available through different settings. Healthcare related information, particular information about sexual and reproductive health, is inclusive and non-discriminatory. Minimum standards for HIV, TB, STI, and hepatitis services, especially in prisons, need to be domesticated, implemented, and monitored. At the time of the development of the minimum standard, there were very few countries where these have been standardized. So we would like to actually go back and see what changes have happened since 2019. So the opportunities for parliamentarians under the last theme would be they can use their roles on committees to request information about programs and services for key populations, or their role around accountability. They should work with key population networks in constituencies to monitor access quality of services. So they have to go back and meet with the communities and make sure that services are being accessed by key populations, and assist where that is not the case. They have to participate in prison oversight bodies to monitor access and quality services, and participate in budgeting processes to advocate for monitor domestic contribution to services. So these are the opportunities and the situation and opportunities for parliamentarians, and this is essentially a summary of the minimum standards. So that this is what at a minimum parliamentarians need to be doing for protection of key populations. My last slide is basically about implementation and monitoring. Obviously, the lead role is for parliamentarians. National governments will obviously have to be in there. The SADC Parliamentary Forum is the one which developed the minimum standard, and it needs to basically make sure that it is properly rolled out and implemented. Also, immediately after the development, COVID set in, and it really impacted on the rollout of the minimum standards. And then key population networks and technical partners that are supported in the development need to be involved. In conclusion, I would just like to say that while this minimum standard was developed in 2019, we believe that it is still relevant. Yes, it is still relevant. We could still look at the situation analysis and update some of the situation to understand where we are within 5 years. Especially, we also need to look into inclusion of recent good practices. We have heard this morning a number of good practices, specifically around key populations. Obviously, we at a certain point, we have to transition from our public health oriented approach, which we have followed in developing the minimum standard, to a more human rights protection approach. And then I would have to say that probably after revisiting the minimum standard, we will need to translate it into Portuguese and French to make it more accessible. But again, I would like to say that it is still a very valid and relevant document as it is. So I really encourage parliamentarians to make use of it. With that, I would like to ask my colleague, Monica, to quickly take you through the parliamentarian handbook. Thank you very much from my side. I hope you can make it quick. No, you don't see it.
Good morning. Yeah. My name is Monica Tapengwa. Like Boyamo and Magdalene, I'm from Botswana. So I'm very happy to be here to catch up with two of my colleagues. Yesterday was Botswana's independence. So Pula, yeah, so we had a lot to catch up on. And I'm also happy to be here because we've collaborated quite a bit with SADC PFS. You had my colleague talk about, you know, the standards which were done by SADC PF. Miss Fini, just the arrows, yeah? I just pressed the arrows, yeah? Okay. So as he said, we have been working with parliamentarians, and the idea to engage people or champions or people that have a responsibility to protect, and parliamentarians, by virtue of their duty and their mandate to make laws and pass laws, we believe it's important that we engage them. We make sure they understand their responsibility to their constituencies and to everyone, you know, and to the constitutions within the countries that they operate on. And so we decided parliamentarians were an important target group to engage. And in the way we engage them is, you know, trying, understanding the difficult terrain that they work in, especially in relation to the issues around sexual and gender minorities or LGBTI issues, the difficulties navigating through religion, culture, tradition, etc., opposition. You had my colleague from Malawi, I believe, was talking about how there's now a movement, a solidified movement coming into Africa and organizing against, Western, what they believe is Western imposition, and trying to promote what they believe are African values, bringing back the so-called African values. The unfortunate thing is they don't actually engage anyone. I think we should know better what our values are, what our African values are, what family looks like in Africa, for instance. To say a man, a wife, and his kids is we know it's a fallacy. Families are different, families are diverse, and so I think that's the important thing. That's primarily why we felt we need to engage parliamentarians. We know this opposition is getting successful in terms of getting some parliamentarians actually to spearhead some of the bad laws that have been passed against sexual and reproductive and health rights, against homosexuality, against abortion. And so there is actually a very urgent need to kind of address this and make sure that parliamentarians do what is right. Parliamentarians respect their mandates. And some of you as researchers and working within parliaments, you do most of the work for these parliamentarians. And so, having the tools that we can produce together to help you navigate through this difficult work is important for us. And so what we did was to produce this handbook. We call it a parliamentary handbook, advancing the human rights and inclusion of LGBTI people. And this is a global handbook. It's not just for Africa. And so initially when it was produced, there was actually very little in it about Africa. It's specifically on LGBTI issues, not SRHR. And there was very little to really include. There was little improvement. At the time, we had about 32 countries out of Africa criminalizing same-sex conduct. And there are 54, 55, depending on whether you count those countries in the north. 54 countries in Africa, and out of those, 32 were criminalizing same-sex conduct. And many of those were actively implementing the laws, meaning people were getting arrested, people's rights were being violated, etc., etc. And there was really no appetite or no desire to do anything or to change these laws that we inherited from colonization. So we know activists have been working around this since even before Beijing. There's been a lot of work of activists trying to change the laws, and there has now been improvements. We've seen courts, judiciaries rule that some of these laws are unconstitutional. We've seen parliaments pass laws by themselves and change or repeal the criminalizations. And so what we decided to do was to update this parliamentary handbook to include now content from Africa. So it's now also quite useful in that it brings a lot of information. There you go. Can you see? It's coming up slowly. Okay. You can see now? Okay, so yeah, so we revised it in 2022. In 2022, we have included the changes in laws in Mozambique, for instance, the repeal through the courts in Botswana, and a few others that have happened around the continent, which is really important because it's a good book. It gives practical examples on how to deal with some of the false narratives that are coming with the opposition. And just exchange of good practices, I think it's a good thing. You don't necessarily have to copy and paste, but you can adapt. You can look at what has happened in Botswana and adapt that to suit the country that you are in. So as you can see, there are different things that have happened in different continents. At the same time, we know that we are part of a global network, right, at the UN. And the UN has passed many treaties, many declarations. There are committees that deal with human rights. It was important also to kind of walk parliamentarians who don't always know about even sometimes what the country has ratified. A lot of the parliamentarians don't have that information at hand. And so this handbook gives some of that information. You can get that information to understand how you can champion rights, how you can be an advocate within a parliament, understanding what are the human rights responsibilities from the top, from the UN level, and then coming into your own constitution. So the other thing, as you know, UNDP developed the Sustainable Development SDGs goals, which there is a global call, leave no one behind, right? And that is an important call for everyone, especially for government, especially for parliamentarians. When it says leave no one behind, it means pay attention to all the vulnerable populations, right? Because of course, when everything is being done, who gets left behind are the minorities. And so that means you have to pay attention to those minorities to ensure that they are not being left behind. And some of those minorities are LGBTI persons, sex workers, people with disabilities, etc., etc. And so, but this booklet, of course, it's for LGBTI persons. So this is basically why we thought it was important to come up with this booklet. You brought copies? Yes, I have copies for everyone, which I will distribute. We also have this at the end. I have a link that you can pick up on. So it's a booklet that you can use. It's very practical, and you can use bits and pieces of it without having the whole thing. So it has 4 modules or 4 parts. And as a start, when you go into a committee, a lot of people don't understand what all these letters mean, what they represent. And so it gives a simplified explanation of what it is, who are these people, and how do you deal with some of the issues. We understand in Africa, sex is a taboo subject, or maybe it's not a subject that you talk about, but it has become a public issue. It's become a political issue. And so we have to discuss it because lives are at stake. We know that there are kids committing suicide today because they are misunderstood. They are being bullied in school. We cannot continue to ignore that. So we have to address these issues, understanding what the T stands for, the I stands for, the G stands for, and how do you even stand up and talk about it? When we say SOGI-esque, what does it mean? Sexual orientation, gender identity, and expressions, sex characteristics, right? All of those words you have to understand and be able to engage with people who may not necessarily understand the English language. Find the terminology in your language, which I know we have them, terminology that is inclusive. A lot of the terms can be quite, how do I say? They denigrate and they dehumanize people. Those are not the terms we want to be using. We want to be using inclusive terms. So this, I think it's something that you will find many of the NGOs in your country have small booklets where they explain in local language what it means, what is a gay person, what is a lesbian, etc., etc. And I think that's the way to go. And then part two, as I said, it's about international and regional instruments. We have the UN and all its treaties. Then we have the African Union with all its treaties. Somebody was talking about the Maputo Protocol, what's the other one? The one on children. All of these are important, and you have to be able to bring them up and use them. And I think the African human rights mechanisms are very important because they are homegrown, right? And so, which is why we have the African Commission on Human and People's Rights, the African Charter on Human and People's Rights, recognizing that we have communities that we work in, also we have individuals. So you have to protect both community and individuals, in your work. It's slower. Right. And then part three, it gives some of the usual entry points. For a long time, LGBTI issues were being discussed through HIV, which was important at the time because HIV was there was money in HIV. Everybody was working in HIV, and the resistance to just raising issues around homosexuality was so much that you needed to go through a different way, a public health entry point. And it worked, it opened the doors. Now we are inside, we need to kind of put a face behind all the letters and say, it's very well and fine, but HIV is only one part of who I am as an individual. I have a life. It's a sum. It's like, what do we say? A sum of the whole, right? So it's not. You shouldn't just be seen as a vector of disease, but rather as a human being with a life. You could be disabled. You could be a woman, a man, intersex. You could be in any of those things, and then we all have a sexual orientation, whether you like it or not. It doesn't have to be the same. And so basically, those entry points are important. It's important to identify and say, when people say, I self-identify, I'm not an MSM. MSM is not an identification. It's a term that's a public health term. I am a gay man, I'm a lesbian, I'm a bisexual, then those terms matter. And we need to have those as entry point. But in some other countries, for instance, I think many countries these days are working on intersex issues. I know Zambia is coming up with a medical protocol. In Zimbabwe, they are discussing intersex. In DRC as well, all of that is happening. That's an entry point that you can use because parliaments and governments are willing today to discuss intersex. That means documents. Children are having surgeries or they are being put through surgeries just because they are born with intersex characteristics. And those surgeries, nobody can tell for sure that that child is going to grow up to identify as male or female. So why subject a child to surgery that may destroy their future, right? A child's sexuality is not determined at birth. It manifests as the child grows. And so it is important for for the medical interventions to be appropriate and done properly with the appropriate consent, right? So that medical protocol, for instance, in Zambia, is something that can be shared across the continent. There are many other harmful practices that are going on within the continent. We had in some countries, we actually had a meeting with parliamentarians, SADC PF and Outright, where we discussed these conversion practices, and we were told that if in some countries where intersex children are born, they are thrown away or murdered, right? And that is one of the worst, I think, if it's a traditional practice, that can happen. And some of those things need to be addressed, right? And this is a way to find how they deal with it in Nigeria, the same as FGM. Somebody was talking about this. It's a tradition. It may have been necessary whenever it was, but I think in today's life where we are saying everybody is important, every life is important, we need to address some of these issues. So you need to find all of the important lessons. SDGs. Every country has a plan on SDGs. And when you say leave no one behind, the economic, social, and cultural rights, we're talking about right to housing, right to health, access to all kinds of life-affirming services. We know, excuse me, I get carried away. Right? So SDGs are an entry point for many countries. When that discussion is being done, make sure, as a parliamentarian, make sure that the CSOs working on these issues are brought in so that they are included, they can be part of the plan. When we're talking about Agenda 2030, we know that in 2030, we will have an inclusive and just society like we promise, right? So this is what it means. It means doing a mapping to understand where your country is going and finding those little points where you can work, and also encouraging mainstream organizations to work with the smaller one, mentor them, right? So that's, I think it's important in that way. Yeah, so part 4 is basically to address some of the myths and find practical arguments, right? So when people say homosexuality is an African, how do you answer that question? We all know it's not true, right? We all know that it's been there. It may not have been celebrated in terms of the, people having a rainbow and walking around holding hands. But nobody ever walked around holding hands or kissing in public anyway, whether you're heterosexual or whatever you are. The important thing is sexuality was a private affair. It was between you, and whatever you do in your house is your business, right? But importantly, people were not put in jail just because they loved someone of the same gender as they are, right? And so the whole thing that saying it's an African, we've always had an aunt and uncle somewhere that we know, and I know you know, and this person was never vilified or
You have 4 minutes.
Yeah, I'm almost done. So I think it's important to be able to address those myths, right? Is there homosexuals are pedophile? Yeah, they abuse children. We know that most of the people in jail who have abused children are not homosexuals, right? So all of this, we know these are untruths. So we need to be able to come up with ways to address this and just be honest and say there is no need to do this. And at the end of the day, all our countries are facing crises that has nothing to do with homosexuals. Religion, when people say because of your sin, the country is having this disaster. That's ridiculous, right? Nobody, not one person's sin can be so strong as to change the weather. You know, the snow that we've been having lately is because homosexuals are marching the streets. That's just untruths. So I think we have to be honest and just address this. But the important thing is parliamentarians having the strength, the tools, where you find champions who are willing to be advocates for rights, giving them the tools to be able to do this well and do it correctly, I think is important, which is what this handbook is trying to do. Yeah, we're getting there. Okay, so you see, yeah, so yeah, this is basically what we are trying to do with this handbook. And UNDP, we've been trying to build a network of parliamentarians together with SADC-PF and other partners, parliamentarian champions. And these are men and women and others who are willing to stand up and in their own countries and champion inclusion, champion non-discrimination, and tell their countries and you know that it's not right to treat your citizens the way they do, and be able to go to the African Commission or the UN and talk to other countries like Uganda and a few others that are seeking to pass more laws to criminalize same-sex conduct. So in a nutshell, that's it. Thank you.
Round of applause for the UNDP experts for such insightful, thoughts on this very complex subject. For the last 2 days, we've been really talking about how difficult or how complex it is. And let me give you an opportunity to ask questions or to comment on this. Before that, let me also highlight that we'll be getting into another presentation in the next 10 minutes. Dr. Govind is actually online. So I'll propose that instead of going for a tea break for 10 minutes, let's pick our tea and sit, so that we save time. We can have our waking tea. So if we can go out one by one to pick our tea and give ourselves an opportunity to engage with Monica and Meslin, that will really be great. I hope that is agreeable. Questions? Yes, I see you. Over to you. And then I see Lesotho.
Thank you very much. I would like to also thank the presenters for their stimulating presentation. It's an issue that I'm very passionate about, key populations. I did a whole PhD on framing of key populations by the media in the context of HIV and AIDS. I'm interested in knowing from our experts from UNDP, first of all, how did you produce this handbook? Who produced it, and what was the involvement of key populations themselves, and what was the involvement of media practitioners? Because the media can frame in or frame out people or issues. And so I'm also interested in knowing how you propose that we work with the media, how we engage with the media. Do we deal with them as partners, or do we deal with them as ignorant people who need to be educated about key populations? Talking about training, which should be my third point. When we talk about training the media, from where you are sitting, what do you propose should be the procedure or the strategy? How do we train the media? What do we train them on? What skills, what knowledge do we need to provide? The SADC Parliamentary Forum has partnered with the media under this project. In 2014, we started engaging and partnering with the media, and we had a specific strategy where we targeted what we called gatekeepers people who have the right or the power to stop a story from getting into the media or going out. And so we spent quite a lot of time and resources engaging with influential editors in Southern Africa. And what we saw, incidentally, I did my PhD based on the work that we're doing at SADC when I left. And, you know, if you care to go and look at my thesis, it shows that from about 2005 to about 2018, the number of articles that appeared in the media about key populations went up quite significantly. And the voices of key populations themselves also were getting quite visible or noticeable.
Keep the questions brief,
yes,
if we can.
I'll end by saying that there's an observation that a lot of the media houses in Africa are practicing something called objective journalism. What is your view on that? Do you think it is a model that works for key populations in Africa? Or would you want to propose a different brand or model of journalism? If so, what would you recommend? Thank you.
Thank you very much for the questions. Lesotho.
Thank you so much. Mine is very short. In the presentation, there was a discussion on the I in the LGBTQ, and other letters. I am interested in the I because it made a lot of controversy when we're dealing with the Child Protection and Welfare Amendment Bill, that we're still working on it.
Do you want to share with others what the I stands for?
Intersex. There was a lot of issues relating to that because there was a motion on the amendment to say a parent should have the legal backup in terms of deciding, though with the medical expertise, in terms of deciding the identity of the child. This was prompted by some of the issues that were raised at committee level, where some intersexual people were saying the abuse that at an early age. We all know that you get to have your human rights when you're born. However, some of these things, children experience them at a really young age, and they get to be abused and they start feeling the discrimination at that age. So I'm really will wish to have a debate on that matter, and it will really assist us in terms of moving forward. If indeed we need to give the parents a certain legal background or skill to decide for the benefit of the child. Thank you.
Thank you very, very much. I'll hand over to Mesfin and Monica. And I also wanted to say that, you know, what I like the most about this particular presentation is the fact that they have given very practical guidelines as to how you can engage Parliament. The minimum standards, very clear. The toolkit that Monica shared on LGBTQ, very clear. So it must be very exciting for all of you as you continue to refine your interventions in this area. Over to you, Meslin and Monica. I'll give you a few minutes to respond before we hand over to Professor who is waiting for us online.
Thank you very much. Let me address some of the things that I can, and then I will ask my colleague Monica for the rest. So in terms of involvement of communities, for the minimum standards, where I have been part of the process, it has been very much informed by communities from the situation analysis until it was validated. In fact, I think, Boemo, you might remember that in Maputo, when we did the validation, we brought in young people from the key population community. And for some of the members of parliament who came there to validate this minimum standard in 2019, it was their first time to actually interact with members of the community. And they learned firsthand on what their challenges are, what are their needs, what demands they make, and what they need to be done. So yes, it was very participatory in that sense for the minimum standards. I believe the handbook also went through similar processes. Monica can briefly touch on that. On the second question of of media, yeah, I think I always characterize the media as a treacherous maze. So we really need to be very careful in not only for parliamentarians, but for all of us who work on such a controversial, sensitive area. How we craft the message. And that is, I think, especially around LGBT, where the tool like the parliamentarian handbook comes in. It gives us very practical tools and guidance on what needs to be the message. So the most important thing I would say is that we have to have the right message, and we have to also know the right media. Some of the media have a different vested interest. It would not really make much of a difference for us or for parliamentarians to engage in a media that is being funded by the opposition. And the opposition does that. That is, there is now a growing, strong, organized opposition. So we will really have to identify the right media and the right message that we need to get across the media. I have to admit that I'm not really very much into media, so I don't know what objective journalism is. I think you would be able to help us better on that one. On the point of the intersex, I think my colleague Monica will be better placed to address that. And you might also touch upon, Monica, how communities were engaged in the development of the handbook. I think that addresses the two questions. Thank you very much.
Yeah, thank you, Mesfin. Yeah, the handbook was pretty much produced in a similar way. We basically engaged a consultant, and I should mention that we partnered with a global network of parliamentarians, PGA. In that way, we had access to parliamentarians as well, who we asked what would be important for you as you do your championing work. And they told us these were the things that they struggled with. And so we sought to really respond to that need. We also work with CSOs, Pan-Africa ILGA, and in the different countries that we work with, we have partners, and same was done. The case of media, I mean, the consultation was extensive, but obviously we didn't go to every department. And I cannot say for sure that there was any media practitioners that were consulted. However, I believe that this handbook is useful for everyone. While it was meant primarily for parliamentarians, I think everybody can use it because the information is really just explaining concepts and giving, information that exists, but putting it together in one place where it's accessible and it's easily digestible. And so media can use that. Now, the whole thing around how to work with media, I think, people have different approaches, but similar to parliamentarians, they are parliamentarians that we know no matter how long or how much time you spend with them, you're not going to change how they feel or what they think about these issues. And we don't have the resources to be running after those parliamentarians. We are looking for champions. We are looking for people who want to do this work, people who are willing, people who can change and who can move the needle in the other side. Now, people who are interested in inclusion. And so similarly, the media that we work with is that media. And when you talk about objective journalism, why should it be objective when it comes to certain issues? It only comes up when it's women, it's children, it's these why should it be objective? Journalists are individuals, and the houses depends on the owner. When they form a paper, it can be a tabloid. That's not objective. They have an objective to get sensational with issues. And so what we are interested in is ethical reporting, making sure that the right information goes out there. And so that's what we do. We counter what we believe is harmful and the narrative that is being built by these tabloids to make sure that information that is correct is there. And one way of doing that is to find champion media houses, give them the information, give them content, write the opinions, write articles, do research so that they can quote from a research. They don't have to give their own opinions. And I think that is important to do that kind of thing and make sure that that happens. And also nowadays, a lot of people are on TikTok, social media. You have control there, and you can put the information out there and make sure that that when we say I, people understand exactly what the I stands for. The issue of intersex, I think, like you said, parent as a guardian of a child, you have the primary responsibility to guide this child. But there's the important caveat to this power that you have over this little human. It's every action you take must be in the best interest of the child, right? So deciding on their identity, on things that you have no control. Like I said, sexuality, you cannot change someone just because you cut them up, you removed the organ that you don't like, doesn't make them female or male. We've seen intersex children who were put through surgeries, and the doctors will say it's easier to make this child into a female. And then at 12, what happens? The child turns out actually their sexuality, their gender is male. What have you done to that child? Is you have created a situation where the child will suffer health complications for life. Right? That's not in the best interest of the child. There was no need to hurry up that operation. You could have waited and found other ways to protect the child from bullying and from all the other things, rather than do surgery that complicates the health and the welfare of the child. And I think that's the important consideration when it comes to intersex children. And all of this, when we talk about comprehensive sexuality education, I think the development capacities of children, we take into consideration those, and you give children as much as they can take because of their development. They are going to engage in sexual activities, whether you like it or not at some stage. It's better to prepare them. And I think that's what the best interest of the child means. Thank you.
Thank you very much, Monica and Mesli. Thank you so much for the insightful presentations. I believe that our parliaments are fully equipped now with very concrete ideas on how they can position their work around this thematic area at country level. I really believe that the great work that you've already started will be enhanced, will be strengthened. Your capacity has also been strengthened accordingly. I would advise very strongly that these resources that have been proposed by the two presenters, please use them. maximize their use so that you can also equip yourself better to engage with your parliamentarians, and take it a step further by even building the capacity of your MPs, of your other partners at national level to be able to engage on the subjects with clarity and understanding. So at this point in time, I just want to say, let's give another round of applause to our presenters as we proceed to the next presentation. Professor, Governor, good morning. He is online.
Good morning,
so
colleagues.
we will be. Good morning, Prof. You are welcome.
How are you doing?
We are doing really great, and we are looking forward to your presentation. I'll hand over to you right away. Let me know if you are presenting from that end or we are projecting for you. How did you?
I am presenting from my side, so I'm going to share.
Excellent. Professor will be speaking to us on health financing to support universal coverage, and he'll be sharing key concepts, approaches, and case studies. Prof is from is the research director from HEAD and at the University of KwaZulu-Natal. And Prof is a health financing expert, and he has done this work across the globe. And we are so lucky to have him share his expertise and his thoughts with us this morning. Thank you very much, Prof, and over to you.
Good morning, colleagues. Good morning, Madam SG. Thank you for inviting me to do this presentation. It's a real pleasure to do this presentation for you. Apologies for not being there in person, but I think I can convey the information well online. Colleagues, can you see my presentation? Can you see my visual slides?
Yes, we can see the first slide is on the screen. Thank you so much.
Okay. I'll continue. So, colleagues, this morning I'll take you through a presentation focusing on health financing and its link to universal health coverage. I would like to go through some key concepts, approaches, and case studies for the SADC region, and possibly extend a bit beyond that in the East and Southern African region. As we know, universal health coverage is a hot topic of conversations in the region, and its articulation with health financing in terms of how we regulate and manage health is important for the future of the region. In particular, this module will cover, as I've indicated, concepts under UHC and health financing. I'd also like to look at some health financing systems, definitions, financing attributes, paying attention to aspects like how do we raise revenues, what is revenue pooling, what do we mean by strategic purchasing of health commodities, benefits packages and conditions of access, and then management of health financing areas, tracking of health indicators, and then some issues related to governance and some limitations, and then reading resources for colleagues, including this presentation. So, colleagues, before I continue with the presentation, I must say that in this presentation, there are a few graphs and tables. I don't expect you to pay too much attention to the detail. I'll share this presentation with you, but I will point out to some general trends to give you the kind of key messages that I am talking about. So firstly, we have seen this cue before, focusing on universal health coverage and health financing. Universal health coverage means that all people have access to a full range of quality services when they need this without financial hardship. UHC considers 3 areas of coverage: population-based coverage, benefits and services coverage, and financial protection coverage. And if you look at the blue cube, we're focusing here on pooled funds. And pooled funds are really important to finance the healthcare system. A responsive healthcare financing system supports the attainment of the 3 areas: populations, services, and financial risk protection. And we're generating and pooling resources and efficiently financing health coverage for all, and also taking into account the associated risks. So in terms of the UHC cube, it's important to note what services we want to cover, and I've indicated here the types of services that we'd like to see covered in essential benefits packages, populations, including minority populations. And then in terms of financial protection, the most important thing we want to do is to limit out-of-pocket payments, mitigate against catastrophic health expenditures, which induce poverty cycles. So health financing refers to generating, allocating, and using financial resources within healthcare systems. So when we think about a health system function, these are the main areas we'd like to concentrate on. We'd like to think about the health financing arrangements, raising funds, pooling of resources, purchasing of healthcare. What are the benefits that are accrued to population groups? Then we'd like to think about intermediate objectives. How do we reduce inequities in the system? How do we think about efficient resource allocation? How can we think about the system being accountable and transparent? And if we realize the health financing arrangements and the intermediate objectives, then we are likely to reach the aspirational goal of utilization relative to need, improving quality of healthcare, and having universal financial protection. Now, this slide has many areas to it, and I've given this to you to show that in these kind of sections, in terms of attributes, there are particular things to focus on, and that has implications for the financial management systems. But I would like to focus on the blue flow chart below and talk about those 6 areas. So an efficient health financing system, we got to ask the question once again, how do we raise revenues? And the mechanisms to raise revenues can come from government, allocations, external donors, the private sector, and innovative financing mechanisms. And I'll talk about the innovations in the next few slides. Secondly, we need to think about how do we buy healthcare? Who will provide healthcare? Would it be government? Would it be the private sector, external donors? Once we've thought about the purchasing of healthcare, we need to think about what types of payment mechanisms a country will support. Would it be, would the fee structures that reduce oversupply of healthcare be in place? We don't like oversupply of healthcare because it becomes unaffordable, where you're going to see too many specialists doing too many tests, which are unnecessary. But we also need to cater for adequate coverage of different population needs. And we also need to consider cost effectiveness. We also need to think about under what conditions do individuals have to pay for healthcare? It's called fee for service usage. Do we invest in group payment systems where people of a similar condition have a set price for buying healthcare? Do we have a co-payment structure? Can we standardize or cap payments per patient? That's referred to as capitation. What types of funds can be pooled together? Now, pooling of funds, if you remember the previous slide, the blue section is really important. We require substantive contributions through different revenue sources, plus to consider pooling of benefits. Pooling of benefits stabilize costs and manage financial risks. So essentially, the larger the pool, the more resilient financing health becomes. We also need to think about what services should be included in a health benefits package. That has to be based on population or epidemiological profile of a population, cost effectiveness. Then we need to track spending in the health system at a country level. The tracking needs to be standardized so it enables cross-country comparisons. And then we need to pay attention to larger governance issues, integration and coordination across schemes, systems, ministries, and programs. So these are some of the key and essential issues we need to think about when considering the attributes of a health financing system. So we are familiar with the Abuja Declaration, pledging to allocate 15% of national budgets to improving healthcare. We also are aware of the target, been often mentioned, of government spending of at least 5% of GDP. This is aspirational. And these mechanisms, funding, can be seen as getting us closer to the goal of UHC. Now, in terms of government's tax revenue is important to fund healthcare. And there are sources of insurances as well. Compulsory insurances are better than voluntary. Compulsory insurances result in a larger pool of funds. And a larger pool of funds, as I've indicated, means aggregation of risks. We can better manage risks, and the funds can be stabilized. Private healthcare is for the employed and a select group of people with who are higher income earners. We know donor funding has been declining over time and not so stable as country priorities change. Innovative financing is really important. If we think about sin taxes, health taxes, and I'll come to this in the next slide, as an additional source of revenue. And at household levels, we aim to keep expenses low. Out-of-pocket payments are high in Africa, between $1.9 and $3.1 per person. And we got to keep catastrophic expenses and eliminate that, because that induces poverty. So these are the mechanisms of raising revenue for the health system. So in the next slide, I'd like to look at how we can think about raising revenues through alternative sources. In this systematic review, it looks at innovative financing mechanisms in the world, in the WHO Africa region, the scoping review. And if you look at the table, you'll get a sense of countries using alternative revenue-raising sources. And you can see the sin taxes feature high here: tobacco, alcohol, sugar, social impact bonds, as well, etc. And this is really interesting to see how countries are looking at alternative sources of income. One of the challenges, though, with most alternate financing sources is that they are not earmarked for a particular purpose. And this is the problem. We need alternative sources of funding to be earmarked for health. If they are collected as part of a general tax, then the effects on health would not be seen. Sin taxes have a dual system response. They raise the revenue base and also reduce expenditure on non-communicable diseases by incentivizing the public to consume less of these commodities, cigarettes, alcohol, junk foods, etc. Social impact bonds, interesting instrument, can be seen as innovative, and it's being supported by WHO. What are social impact bonds? They are defined as contracts where private investors provide the initial capital to fund an intervention, and governments reimburse those investors when the interventions have reached its goal. So we have about 140 impact bonds that have been implemented in 25 countries thus far. So the big plus for impact bonds is that they shift the risk from governments to the private sector to fund innovative social programs. We have an example in South Africa, bonds for jobs, which placed economically excluded youth into jobs. An example in Cambodia to bring safe sanitation to rural communities. So there are ways to raise revenues, and you can see countries and examples of revenue raising. If we look at the SADC region, and these figures talk about current health expenditure, we see countries, and if you look at the figure on your left and the blue sections, the Lesotho expenditure is high, about 11.9%, Namibia about 8.4%, South Africa 8.2%, and then countries with lower kind of expenditure, Zimbabwe and Angola. So in terms of the Abuja Declaration, the only countries in the region that have met these targets are South Africa and Cape Verde. Most SADC countries are struggling to meet the Abuja targets. And if we look at average in the SADC countries, we're looking at about 5.3, 5.4%. So this is the challenge to get us to this allocating 15% of the budget to healthcare. So in this figure, the pooling mechanism is really important. And the bigger the pooling mechanism, the more resilient the health funders. And the contributions are from various sources. And it's important here that the sources of revenues must be transparent, tracked, and if possible, placed in one basket. That's really, really important because it reduces the risks of financial burden when payments are needed and increases in efficiencies. We've seen previously that most donors are provided on-budget support to health, but that's been done away with because of corruption and inefficiencies. Health insurance helps to pool funds from different sectors. And when we pool funds, as I've indicated, you have aggregation of risks, stabilization of funds, and that results in the fund having a longer trajectory. Just quickly through the slide on purchasing. Different purchasing systems are depending on who's spending. Governments often use capitation. Capitation is fixing prices based on disease burden, population criteria. And another way for payment is diagnostic related grouping. So people with similar disease profiles can go into a group and look at a group payment system. Depending on who do we contract for healthcare, private, public entities, and in relation to this, what to be considered for purchasing. We need to think about the health benefits packages. Prices need to be cost effective, price negotiations with big pharma, donors. So these are some of the things that we need to think about when we're looking for in terms of strategic purchasing. And when do we pay a fee for a service? Again, out-of-pocket costs we need to reduce in the healthcare system. So I'm moving into the next section, which looks at benefits and conditions of access and focusing on health services packages here, health benefits packages. Now, many countries in the region are going through the process of developing health benefits packages. The benefit packages sets explicit entitlements for health services. And in the figure, you see 10 steps which are regarded as a core elements for developing benefits packages. And sometimes benefits packages are developed incrementally using cost effectiveness thresholds for decision making. And in countries where there's capacity, health technology assessments are used to inform benefits packages. Obviously, there's challenges. Countries may lack analytical capacity. There's necessary data on health benefits packages may not be available, health systems constraints, tensions between technical actors and political actors regarding what constitutes the formation of health benefits packages, and obviously the kind of uncertainties and budgetary implications. So we need to think about which groups we're focusing on, what care we provide, how to pay for services, and what level of these services are formulated. Now, in this slide on benefits packages, if you look at the left-hand part of the slide, you can see the kind of decisions regarding health benefit packages. Cost effectiveness ranks very high. Also, disease burden of a country and equity. These factors are really important criteria for developing health benefits packages. I also show you a roadmap for the National Health Benefits Package in Zambia and the processes. As you can see, it's very detailed, it's context-driven, sequential, based on evidence. It includes political and public participation, and it is results-focused and with potentials for adaptability. So Rwanda has gone through this exercise. Ethiopia has gone through the similar exercise. South Africa is in the process with the NHI development. So it's important, the conversations about what constitutes essential package for populations. Okay, in terms of a few slides on health finance tracking. Now, in these slides, you see lots of indicators to track health finance within the kind of PFM framework. And this is important for looking at health expenditure, tracking finances against indicators. And locally, countries use different tracking mechanisms, and the national health accounts is the basis for tracking, for local and international tracking, and it allows kind of some levels of comparisons. The national health accounts provide comprehensive data on health spending from different sources. It tracks both public and private expenditures, and it's produced on a periodic basis for decision making. And you can see here, it looks at domestic spending, it looks at spending on particular diseases, on social health insurances, voluntary financing systems. So there are many indicators here, and complex indicators linked to attributes in the financial system. I want to look at a case study of using another kind of mechanism, which is called health sector resource mapping. And this aims to track external donors and local investment in health. And the financial maps, are both financial and technical resources for understanding healthcare provision. And if you look at the three countries, Malawi, South Africa, and Botswana, and you look at external donor aid, you can see Malawi, like the yellow, there's a high input into the Malawi healthcare system, as opposed to South Africa and Botswana. You've noticed South Africa, the green section, large contributions of domestic funds, and to some extent in Botswana as well. And then the out-of-pocket costs, the purple kind of part of the figure, you would see that South Africa, the out-of-pocket costs are quite high, and I think that's because of paying private service fees for healthcare. But that's once again a persistent concern in the region. But this gives you a sense of tracking healthcare expenditure. This graph has many, there's many figures here. I don't expect you to focus on these graphs in a detailed manner. This is meant as a resource to show different types of indicators. But I just want to make some general summary points to show you, like in a country, the number of indicators that we track and the comparisons we do. So we know that health is funded through a combination of sources: external funding, government transfers, out-of-pocket costs. In Malawi, high external funding, government funding decreases, out-of-pocket spending is increasing. So when external aid increases, government priority and health decreases. Or alternatively, when external aid drops, the government is expected to cover in terms of health expenditure. When government spending on health goes down, it's a major worry because people find it hard to go to centers to access healthcare. Okay. So the last two slides, in terms of policies, it's really important that government consider policies to support health system functions. There also must be support within and across health systems to better manage health, the governance of health financing systems. And we need leadership in various sectors within the health infrastructure, and also the importance of technical working groups to advise on developing, for instance, benefits packages. Challenges in the system: tracking expenditure from national health accounts. It has a 2-year time lag. So we need to note that estimates are usually averages, and while they enable cross-country comparisons, they can be inexact, limited qualitative data. Fragmentation of resources, multiple financing mechanisms make it complex to consolidate data. Syntaxes, a good way to finance healthcare, but it's not often earmarked for health. PFM systems often difficult to track, especially non-government revenues and expenditures. At times, off-budget support from donors is not pooled into government kind of expenditure systems. Program indicators can be limited. No CSE tracker, GBV tracker. So there's some trackers, indicators that we can improve on. Limited capacity below national level. and financial capacity to track and report expenditures. Social impact bonds can be abused, given the complexity of implementing the system. And, we need to work on stakeholder acceptability for tariffs, financing, and funding modalities. I've provided a list of readings here. There's a global expenditure database, WHO, some reading on the experience in Zambia, which was undertaken by a PhD student of mine, Warren, and I've provided a media piece on my take on the South African universal health coverage in NHI and what I think it can and cannot do. So, colleagues, that's the end of my presentation. Thank you.
Thank you very much, Prof. Another round of applause for Professor for sharing such a technical topic in such a way that we all appreciated, what you wanted to communicate, and also giving very concrete recommendations on how we could position our parliaments to engage on budgets and on expenditure, and even to track indicators that are relevant for SRHR. And lastly, he shared comprehensively some of the challenges that continue to prevail across on this particular topic on health financing. So thank you very much, Prof. I'll give an opportunity to the participants to ask questions or to comment as they see fit. Concrete examples were given on member states. Some of them are here in the room, Zambia, Malawi, but over to you, colleagues. I can see you, sir. Sorry. Over to you.
Thank you. Thank you for the presentation.
Introduce yourself and the country you come from.
I'm Tapiwa Shiremba from Zimbabwe. Thank you for the presentation. I got clarity on the private insurance. It appears South Africa is a huge amount that goes to funding, but it's from the private insurance. I just want to understand in terms of population, how big is the private insurance covering up the population in South Africa? My second is regarding social health insurance. I think in Zimbabwe, there's a proposal to bring the national health insurance bill just to increase the coverage around the health sector. So in terms, I wanted just to appreciate using experience where it is more effective. How is the governance and the structure of this insurance schemes? Thank you.
Thank you very much. Any other question? I see Zambia.
Thank you very much, and thank you for the presentation. Not necessarily a question, but maybe just a comment. And the first comment I would like to make is with regard to, with regard to the link that I saw, having financial resources available, but the prudent management of the resources. And I think that is where most countries find it difficult. You can have all the resources you want, but if there is corruption, flouting of procurement processes and procedures, you will not achieve universal health coverage. And that is where PFM comes in. And I see the link with our project, when we talk about democratic accountability and governance, and as researchers, it's an area we need to enhance. In connection with what we were learning a few days ago about sector budget analysis, and I also liked the presentation when you talked about the Abuja Declaration, which reminds me of what we were learning just a few days ago, that we may actually attain that 15%, but the question is, to what extent are we getting quality health from these resources that are being made available, either by donors, cooperating partners, or internally mobilized resources? So it is critical and very, very important that as researchers on the project, we explore how best we can equip members of parliament to really take a keen interest in finances that are meant for health, for the health sector. Finally, just maybe to ride on the comment from Zimbabwe, like we stated in our presentation, Zambia in 2019 introduced national health insurance. This is basically a government run health insurance, and it works in such a way that everybody in formal employment makes a contribution. It's basically those who are able to afford contributing to a pool of funds to finance the poor, for those who really can't afford. So the same way you pay, for example, your insurance, I mean your pension deductions per month, or your tax. So a tax, the same percentage which for those who are in the formal sector are contributing to the National Health Insurance Management Authority, which is tasked to manage the fund on behalf of the government, basically. So my appeal would be, as Zimbabwe, for example, is about to come on board, to learn from Zambia. We can coordinate and see how we can share the act and experiences, what has been done at parliamentary level, which can inform processes which are currently going on in your country. Thank you.
That's excellent, and sharing of experience is very important. I don't see any other hand. Any more questions? Any more interventions? If not, I'll hand over to Professor to respond to the questions and also to speak to the interventions that have been presented by Zambia and Zimbabwe. Over to you, Prof.
Thank you, Chair. Can you hear me?
Yeah, clearly.
Okay, so let me begin with the last comment. I think it's when I put the slide up regarding the process for Zambia, I thought it was a well-constructed process in terms of the development of health benefits packages, and I think that's a good kind of case study as the recent speaker indicated, as a process to learn from on how to develop health benefits packages, and it's it's near completion, and other countries are engaging in this process, and the benefits packages essentially cover the primary healthcare services, and what I've indicated in the slides, maternal child health, essential SRHR services, infectious diseases. Those are important parts of the health benefits package, but also to cover areas like comprehensive sexuality education and gender-based violence. So yes, good learning from the Zambian case study. Yes, the PFM framework is crucial, and the SADC model law on PMF is so important because it enhances accountability, transparency, and efficiencies in managing public finances, and it kind of pushes parliamentary oversight on performance-based budgeting and those related kind of mechanisms. I think the challenges in this sector is a lack of kind of expenditure priorities for governments. Governments struggle to prioritize and spend effectively, inefficient systems of resource allocation, possibly weak accounting systems, inadequate oversight, insufficient parliamentary scrutiny, enforcement of power regarding, the oversight of health budgets, for implementation in places where budgets have been prepared. Sometimes there's poor execution and inefficiencies, and obviously the issue of corruption. So the model law is meant to kind of harmonize processes per countries and provide guidelines, normative instruments to be able to improve the financial management systems. But it requires advocacy for domesticating this at country level, and I think that's where the hard work is and the challenges are. In terms of private insurance, I think we have to understand that for a health insurance to work at a country level, we need one system, I would think, because we need a large pool of funds with different types of populations invested in those funds. So we have risk pooling. So if you think of the cube, the blue part of the cube in the slide, if we have the young and old invested in one kind of pooling system, then we are able to adjust for risks. The younger people can provide, less likely to use the system they're more disease resilient compared to older people in the system. And when they get older, further younger people come into the system and compensate for that. So the heterogeneous pooling is important for a healthcare system, a financing system, and the bigger the pool, the better. Private healthcare is like in South Africa there are about 80 medical aids in South Africa. It's not managed properly, and it's the provider-induced demand is high. What I mean by this is that we use it unnecessarily. When there's too much of private healthcare, then specialists and doctors try to overuse the system. So you go for many specialist consultations, many diagnostics, sometimes which are unnecessary. So we submit to medical procedures that may not be necessary, and that's where the cost of private healthcare escalates and it becomes unaffordable. So that's the problem. In South Africa, in 2018, the Health Market Survey, which was a review of private healthcare, indicated that at this rate, it'll be unaffordable, and we wouldn't manage private healthcare. Medical aids, we wouldn't be able to afford the medicals that we currently subscribe to. So that's the problem. But in the public sector, we have the issue of quality and a failing healthcare system. So I think the mechanism is to have one system, and how to do it is the devil in the detail, and the questions and the controversies and the debates. Yes, the point about the Abuja Declaration, it's an important policy instrument, and countries need to be pushed to reach those targets. More countries need to be closer. I mean, if you look at countries like Zambia, probably about 8%, Botswana, around 11%, Tanzania, 10%. and some countries fall way below. Angola around 5%, Mozambique 6%. So we need to have more political will to meet those targets, because we need more resources for healthcare in the region. Thanks. I think I've answered the many of those, the first round of questions or comments, I've provided some input into. Thank you, Madam Chair.
I think you covered all the questions unless otherwise, but thank you so much. Prof, would like to give you another round of applause, and thank you so much for your time, for the comprehensive presentation. Very instrumental going forward. It's going to support, parliaments here to strengthen their initiatives around the parliament's role on oversight and budgeting, and to a great extent on legislation as well, where appropriate. And I believe that more capacity development for our parliamentarians will be ensured around public financing, but particularly around strengthening financing towards SRHR. When you spoke about tracking expenditure on SRHR, I thought that was a very important element that parliaments could actually, particularly for the researchers, focus on. So that they can have evidence-based data to inform our parliamentarians in decision making and also in influencing budgets accordingly. So thank you so much for overemphasizing the need to take advantage of the already existing resources. The SADC PF model law on public financing, we know it is already in place, and it's a guide to all of us. And if we can also influence our member states to domesticate this particular model law, it will take us a long way. So more advocacy, very critical in this area, but again, collaboration and more collaboration with experts in finance. This is a very technical area. Health economists, should be involved and engaged, and researchers as well as committees of parliament can do a lot in this particular area. Thank you also, Prof, for sharing the reading list. The reading list is very comprehensive, and I believe that our national parliaments will be able to utilize them to strengthen their knowledge and skills on this topic. So thank you very much, Prof. I think that's the end of your session. Unless if you have something very final to say, I'll say bye-bye.
Thank you, Chair, for conducting the session. Once again, thank you for inviting me to make this presentation. Thank you in particular to the SG for the support and of this meeting, this conference, and I wish you well in your further deliberations. Thank you very much.
Thank you so much, Prof. Have a lovely day. Bye.
Thank you. Bye.
We will proceed right away to the next session on the agenda, which is the almost last but one item on the agenda. I'll hand over to our SADC PF internal auditor, who will take us through a SWOT analysis. The item is just come. Let me read the item on the agenda as it is. Yes, this is a SWOT analysis of implementation gaps and learnings. Thembu Kosi, internal auditor SADC PF, will take us through that session. Over to you, Sam, and
Morning. I know we've been sitting down for so long. Yeah, I think we can just stand for a minute or two. I know, Simon, I haven't seen you stand the whole morning. Sorry? Oh. Rachel, do you remember I have the ball?
I have the ball. I throw it up.
I throw it up.
I catch and jump.
I catch and jump.
I turn around.
Turn around.
I spin the ball with my foot.
I spin the ball with my foot.
I tap the ball with my head. I run around and sit down.
I run around and sit down. That was good. Okay, while we're waiting for ICT, there's been a lot of sharing, particularly on the thematic areas earlier. There's been a lot of input also from Zambia and the rest of the team. But what I want us to do right now is to perform a SWOT analysis, basically from our respective countries. I will guide you in terms of how we're going to do that, but we're introduced to a tool area called the Mentimeter. For those of us that weren't around, I'll show you how to do that. But basically, each one of us will log in and then we'll share ideas on that Mentimeter. So just waiting for ICT to finish up. But basically, what is SWOT analysis? SWOT analysis is basically a framework that allows us to identify, assess, and understand internal and external factors that may affect, in this case, the project. Why are we performing the SWOT analysis for a project like the SRHR project? SWOT analysis is performed for different reasons. But in this particular case, we want to bring alignment. We want to learn from each of the countries what is working, what is not working, what opportunities we have, and what the risks are for each of the countries. Once we do that, we want to take advantage or leverage of those different factors that are there. Thank you, Chip. So I've already talked about what SWOT analysis is, basically a framework, and it is a 4-factor framework. As we can see, we have 4 letters there, SWOT. So the first letter is strength, the W is for weakness, the O is for opportunity, and the T is for threats or risks. As to the Y, I touched on that. We want to bring alignment, and SWOT analysis is also part of risk management. We want to make informed decisions, so we want to analyze and understand what's going on in each of the countries, and also bring sustainability. If we take advantage of the opportunities and we also strengthen where we're weak, we'll bring sustainability to the project and also bring growth. So what's the approach that we're going to take? Basically, SWOT analysis is also known as an environmental scan. And in that process, we have to choose who's going to do the scanning. In this case, it's all of us here present. So we're going to use the Mentimeter as already alluded to. Each country will submit responses to all 4 elements. So we have 4 elements, SWOT, and each one of us would have to contribute to each of those 4. And eventually we'll have a consolidated position in terms of what each one of us is facing, and then we'll do a gap analysis at the end. So because of time constraints, we have 4 elements. We'll limit them to 5 minutes each. Meaning to say, when we go to S, all of us will have 5 minutes to chip in. Zambia, you would have to contribute whatever you're experiencing there within that 5 minutes, and so will the others within that 5-minute period. And also just to emphasize, for us to properly learn who contributed what to this exercise, I'm proposing that to each response, at the very end, we simply write which country contributed that particular point. So if it's an issue, let's say for an example, public hearings that we have heard earlier, just put at the end Zambia or Zimbabwe or Angola, so we know where this experience is coming from. So we have a detailed list of issues within the Mentimeter. So that being said, I'll take you to the Mentimeter. And we're waiting for ICT. But be prepared. The first element is strength. So you might start running your engines and generating the responses. What are the different strengths in your respective countries on the project? And mind you, the answer boxes that you have when you log in, you might have about 3. You're not limited to the 3. You can use one box for 10 points, as long as you indicate which country it is. So feel free to give as many points as you can. Okay, we're back. So you have a QR code there. To log in, simply scan it or go to that particular website, menti.com, www.menti.com. Once you're there, you'll find the login field and punch in the code there, 13108244, and you should be able to be on the same page as I am right now. So let me know if you're having any issues. Ronald will assist you with that.
If your phone is too far to detect the code, feel free to come closer to the screen.
But also you have a group. I'm sure you have a WhatsApp group. If you're close to the screen here, you can just take a photo and share on that particular group so that everyone has it also. So I'm sure we're in. I'll proceed. I'm told some are still not yet in. Okay, so as stated earlier, the first question is, what are the unique strengths of your research approach or methodology that is in your various countries? Your unique experiences in your projects in your various countries. So the answer can be 5 points on this particular one from one country. Feel free to chip in. And as stated, you have 5 minutes for each slide, for each question. So the counter is starting now. Seems we have forgotten the instructions. Remember to indicate which country you are. Eleven responses so far. We see Dennis there, and if Dennis is a country, we have Dennis on the responses. But I know Dennis is from Malawi for sure. You have 2 minutes. It appears a lot of us are scared of indicating our countries. But it's also fine. We are getting the ideas all the same. But Madagascar says collaboration. $50 seconds. We have a total of 44 responses, as you can see. And we have 30 seconds to go for those that haven't submitted. I see Madagascar, you're still typing. Okay, and our time is up. All right, so instead of going through them now, we'll go through them at the end where we do the gap analysis. So we'll move to the next question. So what are the limitations or challenges of your research? At this point, we're looking for the weaknesses you feel that are there in your environment as you are implementing the SRHR project. Someone says data. Okay, elaborate. You can send another response. What is with data that is there? We need to learn more from that. And he's talking about cultural myths and barriers. Okay. Mozambique is talking about barriers as well. And one just says validity of source. What are we referring to? Is it information or the data that you stated earlier? Namibia says stigma with regards to LGBTQ. One says thin personnel to execute. I'm assuming you're referring to the project. You have 2 minutes. Okay, our time is up. We have 41 responses. And we're moving to the Third question. So what opportunities can be leveraged to increase the chances of success of the project? I'm sure that's clear enough. One says ownership by parliament. Okay, interesting. TV and radio, Zambia. Support from the speaker. Public hearing by Madagascar. You have 2 minutes. One says review of SRHR legislative. One says proper training. Okay. But remember, these are the opportunities we need to look around within our environments to take advantage of. You have 1 minute. Okay, time is up. So we're going to the final element of the 4. So what are the threats or risks that are there or that the project is exposed to? In this particular case, you're looking at the threats, usually external to the project, that you believe are likely to hinder the successful implementation of the project. Our neighbor Zambia says 2026 elections. One says lack of supervision. Another says multiple roles. If we could have help with one of the words here, it says vontade politica. If we could have translation for that one, to also get what our friends are saying. You have 2 minutes. Sorry, there was one word that I requested interpretation. I might have missed the word there. Was it already translated and I missed it? Yes, again. Yeah, must be here. Thank you. You have 1 minute. Okay, thank you very much. That was a beautiful session. So this is the end of the scanning phase of this particular exercise. The remaining portion is simply for us to look at the responses and analyze the gaps. So for this particular phase, the approach can be where we go through the 4 pages, and then each member or from each country can contribute from wherever direction, because we have all sorts of angles here. So for example, we can start from this going backward. These being the threats, we started with the strengths. We can then align these 2 pages just to illustrate the whole essence of this particular exercise. And mostly, you will observe that each of these pages has a theme to it. Some of the issues are cross-cutting, they are similar, and therefore the solutions can be the same from the very first page. So it's not like we're going to go through each of them, because most of them are almost thematic, as already said. So what we can do now is quickly go through this last page pick out what we feel is the theme from this. I'm sure you're going to do that. I've already done it. And then I'll go to the first page to say, okay, from the risks that you have observed here, what do you think are the strengths that we can use? Okay. It's a lot of responses, but I'll give you 2 minutes to go through that whole page. And then we can raise hands to give responses. I'm sure we remember the strengths we raised and the opportunities that were already raised earlier. So that's the whole essence of this SWOT analysis. Okay, if you are ready, you raise your hand and we'll get to you. But just to give you an idea, I might start off the show. You'll see that there's 2026 elections in Zambia, 2025 elections in Malawi. That's a risk. The risk is there in the essence that as election cycles come in and out, members of parliament are elected, new ones are coming in, the old ones are going out. So there's a risk of succession planning or succession with regards to the knowledge being passed on from one set of members to the other. That's the description of the risk. And in terms of how we can resolve that, I'm willing to listen from you from the strengths that we raised earlier. And if anyone has a better, okay, we have a hand.
To try, maybe we can mitigate the risk by institutionalizing the SRHR governance and AIDS project for a prospective succession plan. Thank you.
Okay, that was a good one. There was another hand behind.
I had the same point. I was going to say capacity building for the parliament staff so that they can be able to pass on the knowledge to the newly elected members of parliament.
Okay, that was a good one. We're going to go back. So it's going to be, that is now the gap analysis where you're going back and forth between the 4 tabs and assessing what's going on there and aligning them. And as you remember, we said the whole purpose is also to align, to bring strategic alignment, as stated in my earlier presentation. Sorry. That's the last page, the threats. So I think this is the most important part and the weaknesses page so that we develop responses. So if we have another response, we could do 3 or 4 and then possibly end from there. There's another hand. Yes.
Yes, please. And for the parliament that are similar to ours, where we have the upper and the lower houses of parliament, I have seen it was one of our weaknesses in the previous phase where maybe we overlooked the issue of engaging more with the more permanent structure of the senators that form part of the parliament. So when the legislatures from the national parliament, when they have gone out and the new one have come in, at least you will still be having a more rather permanent structure of senators who can be able to collaborate with the newly elected ones. So it's important also to capacitate members of parliament from the upper house.
Okay, that's a good one. There's another hand there.
Thank you. For me, it's just to learn because sometimes what you've submitted, when somebody else submits, then you realize maybe it's also your threat. I would like to understand dependency on parliament as well as lack of supervision and what are the remedies? Thank you.
Okay. Did we get the 2 questions? The questions are not for me alone. They're for all of us because we're all experiencing the project in different perspectives. So I hope we got the questions. One was to do with supervision. That's the one that I got. And who is ready to give us the response to that? The other was to do with dependence on parliament. Okay. Sorry, you wanted to chip in? There are hands here that I've seen wanted to respond to that. So we might start with you, Doc.
Thank you so much, sir. Maybe with the one on supervision, it would be with reference to, once again, institutionalization, but with ownership by the office of the clerk of the project, as well as the presiding officers.
Yeah.
Sense of ownership and passion for the project.
Thank you. And the next.
I'm going to answer this one from the angle of having an integrated sort of a plan with the parliament. The other question in terms of depending on the parliament, because one of the challenges that I have realized that most of us experience is the issue of not having to align our schedule with the parliament schedule. So I have realized that it is quite important to realize that parliament on its own, it's an entity that has a different schedule from that one of the project. So it is quite critical for us to collaborate more with the committees in terms of ensuring that our schedule is not contrary to that one of the parliamentary committees.
Okay. I see a hand here from SG, and then we'll come to you, Sam. Oh, we'll come to you.
Okay, I just want to ask, not the researchers, are we still with the head of committees? Oh yeah, Nakuta, at least I've heard your voice. Do we still have them here? It's only Lesotho. Oh yeah. How many of you are aware of the work plan on the project that was sent to Parliament? Okay, it's fine. I don't need a response.
Okay, I hope we got the point from that. Simon, you had your hand up.
Yeah, maybe the other threat to the project will be the misconception by members of parliament to the whole project, because they might have a different understanding. So therefore, proper education needs to be bottled down to all the members of parliament, so they are on the same weight level of understanding what the process, what the project really entails.
Okay. I think maybe just to add to your point, in terms of where there's a lack of alignment or misunderstanding as to the project objectives, I think it is the role now of the researchers to present the right information to the members of parliament. You have visibility packs that were developed way back, and that can be the basis of sharing. And then you also have a project proposal that's an internal document, but I'm sure it can also be shared, that outlines the activities of the project and the results that are intended from the same, just to bring proper clarification to the same. Okay, we'll start from here. We have a hand there, and then to Madagascar.
Boa tarde. Bom, eu queria passar a experiência de Moçambique, porque nos parlamentos nós temos lá um secretariado e mesmo nas comissões temos os assistentes das comissões. Então, por mais que os parlamentares não voltem, que haja já novos parlamentares depois das eleições, eu penso que a memória institucional está lá, porque nós estamos a falar só desse projeto. Há muitas atividades que correm nos parlamentos que devem ter seguimento. Então, penso que o fato de haver eleições não é um risco. Não sei, acho que não podemos considerar como um risco, porque está lá a memória institucional. O que se quer é que haja segmento, haja uma informação e haja continuidade de ações. Obrigada.
Okay, thank you. Madagascar.
J'aimerais faire un partage parce que Madagascar vient d'expérimenter le renouvellement des parlementaires après l'élection. Donc, ce que nous avons fait, c'est que nous avons mis en place, nous avons créé un caucus parlementaire national pour la justice reproductive. Ça a été fait avant l'élection législative. Et après l'élection législative, nous avons organisé une porte ouverte pendant laquelle on a recueilli les nouveaux parlementaires, puis on a organisé encore une table ronde où il y avait les anciens parlementaires et le nouveau parlementaire qui voulait intégrer dans ce caucus. Et on a fait des discussions, ils étaient ensemble. Nous avons même perdu des champions SDSR pendant l'élection, mais on a fait une table ronde pour qu'ils puissent interagir, faire des échanges. Et comme ça, on a pu continuer. Et il est important aussi d'intégrer les fonctionnaires parlementaires qui travaillent avec les commissions. Parce que quand on leur donne des capacités de développement, quand on leur donne des informations, ils peuvent continuer parce qu'ils sont des fonctionnaires qui sont au sein du Parlement, donc ils peuvent continuer à assister même les nouveaux parlementaires. Donc ça, c'était une bonne expérience pour Madagascar. Merci.
Thank you very much. That was a very interesting contribution and very unique. We had a hand up from Namibia, is it?
Thank you very much. I want to speak to the issue of limited resources. The country is not indicated.
Okay.
But just to say that this issue could be addressed through a number of ways. Number one, Parliament have their own resources, and we are working in accordance with our own strategic plans and work plans. And each of the parliamentary standing committees are also having their plans cascaded from there. So, and as an institution, we allocate resources to that. In addition, this particular program also availed resources. There are funding available under this plan. And the funding that is available under this plan is usually within a broad framework. The outcomes are written very broadly, so you can then decide how to structure the activity so that it fits into what you have. In addition to that, through the civil society, the task force, we have in civil society organizations and line ministries that are part of the national working group. They also come with resources. And what I have found in our context is that once we combine all the different work plans, you find that you do not have time to implement all these activities because of the competing priorities. So when it comes to issues of limited resources, there are these innovative ways of making sure that you use your own resources, you add from the SRHR program, but then also there are always the UNFPAs, the UNDPs, the UNICEFs that would want to contribute and want to work with Parliament. So it's one way of addressing that limitation.
Thank you very much. There was a hand on the back table here.
Zimbabwe.
Oh, okay.
Thank you. Basically, I think also from experience, it would be more beneficial if we have a calendar, if we try as much as possible to fit within the parliamentary calendar. Why I'm saying that our thematic areas, as they cut across sectors, you find that you are most likely to find committees that are also running with the same thematic area as you are doing. So if you fit and collaborate, it means you also be part of the runnings of Parliament. Basically, you are able to be supervised in the process, and also you are also able to collaborate and ensure that there is financial support. So it's other than developing your own calendar, fitting within the parliamentary calendar, taking advantage of the same budget align, it would be so beneficial. Thank you.
Thank you, Zimbabwe. That was a very good point. Oh, there's a hand.
Oh, mine is similar to what Mr. Shilaba has just said, that we have a parliament calendar and the project also is a calendar. So we sort of merge the two so that when it comes to implementation, there's collaboration between committees of parliament and the project. And also I was going to propose that for those parliaments with parliamentary academies, they can develop a module on these issues so that when new members of parliament come during the induction process, they can then be taught on the module to do with all these issues that we're talking about here. Thank you.
Thank you very much. This year has the hand up.
No, I'm happy that the Namibia and Zimbabwe have dealt with this issue sufficiently. One of the assumptions of the project is that this project is coming into, I mean, if I come to your house, you invite me to come to your house, and I bring a bottle of juice and something as a guest, does it make it that you'll have a timetable for me when I'm going to drink that juice and food? The project assumes that we're dealing with issues that are already agreed to by governments. And that parliament, when you sign the agreement, if you read the agreement very clearly, you are saying it's relevant and it's aligned. And therefore, we don't expect a situation where there's water for SRHR, there's a notepad and pens that are just for SRHR. That becomes a problem. I think the integration that we are talking about is very, very important because the money can never be enough. That is why even the token that is given to researchers, it cannot compare to a package that you give to a normal staff. So I think if you look at these things, also we get requests, we look at the budget, we get a request, we want to hold the meeting in Stockholm. We want to hold the meeting in, what are the other places? Oshiva, outside, let me not just, Namibia, it just came to mind, but the assumptions are made in this project proposal that some of these things will happen when Parliament is sitting. But when it comes to the project, we then want to invent activities that take people outside. Yet we don't use the formula that is being discussed, where if that is the case, did you have the same in your activity plan, UNDP? Did you have the same ex-CSO? If that's the case, this is what we have, let's combine, then we can maximize, because it's not like we underplay the benefits of taking members out, but it's always very important for ownership, integrating and institutionalizing. Another example, which is the last one, there were circumstances where today a sitting committee of parliament goes for a public hearing on child marriage. Then you receive a concept note. 2 weeks later, we want to do a one on public hearing. Are we not talking about the same MPs, the same theme? So when we talk about institutionalizing, we're talking about exactly the examples that have been given. There's no need to come up with project activities, which are outside the normal workings of Parliament. So I just felt that was important because you find that quick, there's a concept note. Then sometimes you get a message because then you see that, oh, the committee on XYZ in X country was out doing X. Later on, you just see something that is more or less the same. So that is why we're saying, let's plan together with our colleagues. The work plan for the project came last year, October, November. It was distributed in all the 3 languages. So there should be no surprises that we're waiting for something. The whole 3-year proposal was sent, it is known. I don't know if there are any dates now that are different, that are far away from this 3-year frame that has already been agreed to.
Thank you very much, SG. Do we have any more Okay, there's a hand from Malawi.
Thank you so much. I wanted to say something on the limitation, which says all the information. As researchers, we have different roles. One of which is writing background papers for our members of parliament. But when we are doing our research, you find that we always find all the information. The figures are all maybe 2015. So I think to our part, we should be able to collaborate with research institutions so that they do like new research in order to be provided, for us to be provided with at least current data. Thank you.
Thank you very much. Yeah, the issue of collaboration cannot be overemphasized. I think from the very first day, the SG stated the issue of partnership and the partnership model that is adopted. If you remember, and if you have your notes, you will see that point appearing on the very first page of this long meeting that we have had. Any other inputs? Is that a hand? Oh, okay. So this brings us to the end of this exercise. But what I would, excuse me, what I would urge all of us to do is to continue this engagement, because you see that most of the issues being raised here are answered by your fellow within ourselves. So, for example, Zimbabwe raised a very good point, and so did the others. So we have a platform, I'm sure you have your WhatsApp group and other platforms. Raise these issues, raise these questions, you will find the answers within the same. And if there are no answers within those platforms, escalate them, because the answers are always there and we always have to improve on these issues for the successful implementation of this project. Thank you very much.
Another round of applause for Sam. Thank you so much, Sam. And thanks to all of you for contributing so actively into the SWOT analysis. I have no doubt that it is going to assist the SADC PF as well as the countries to address some of the concerns, particularly the weaknesses, the gaps, and also leverage on the opportunities that have been identified, and most importantly, really utilize the data that emerged from this exercise to improve the work that we are doing on this project. So congratulations to all of you for informing your project and also for working so hard towards ensuring that it improves as we go forward. So we have come to we've almost come to the end of our program. And in the remaining 30 minutes, we will now be discussing way forward. And I'll hand over to Her Excellency, the SG, to lead us through this closing session, where we will collectively engage on the way forward under her guidance. Over to you, SG.
Good afternoon. Okay, just a slight change. I will not be doing the way forward because I believe that you made the presentations in terms of the innovation and learning and what you think you should be doing. Is that correct? Or you want us to formulate the way forward? Is there a way forward? Let me proceed to just do the closing, colleagues, because I believe your body language is telling me that you need guidance from us, not for me to ask you for the guidance. So let me just go for and say, Madam Facilitator, thank you very much for your guidance, and let's give her a round of applause. I think we're ably led, and would like to appreciate that. Madam Deputy Clerk, who has graced us from Zimbabwe, the directors from committees and coordinators of committees, the SADC PF desk officers who are here, the SRHR researchers among us, the staff of Parliament who may not occupy those particular designations, staff of the SADC Parliamentary Forum, our resource persons who've been with us, UNDP, SAT, HERD, UNESCO, REPSI, who joined on 9, APHRC. Let me just say thank you very much for gracing this capacity development program. And thank you so much for your dedication. I think it's a concerted feeling that these 2 days have constituted an enriching experience for all of us in whatever shape or form. We have been delighted by the immensely insightful presentations that we have received from the researchers and our resource persons. And I'd like to thank our regional partners who've been here with us for the pertinent and resourceful contributions that they've made during this session. May we kindly appreciate them for that. I'm also happy to note that we had an oversubscription of resource persons from our partners. And this is an indication that they wanted to engage with yourselves, that they also want access to Parliament. They want you to appreciate that they too see the need for sensitizing and capacitating the institution of Parliament. It's also an indication that there's so much data and information out there that can be harnessed only if we drop an email or ask, so that whatever it is that is required is given to us. You'll all agree with me that we've sampled the 4 corners of the sexual reproductive health, HIV and governance implementation. And I believe we are now firmly grounded with data and information, reflections that would serve members of Parliament and staff of Parliament at national level in their constituencies as they execute their mandated roles, and also you contribute to the regional response by SADC PF. It was deliberate that I spoke when I opened about the SADC, which is regional and executive oriented, and the SADC Parliamentary Forum. It is for this reason that I believe that we've been able to demarcate the value addition for both, one being policy making and being able to hold that policy framework as a promise to the people, and one that wants to facilitate where people can hang their hopes and be able to actually realize those ambitions and hopes that are contained in policy. As we draw to a close, I wish to share a few useful takeaways which will serve you as you navigate further beyond the, is it 4 days? Yeah. For researchers, it's been 4 days of capacity development. And for our seniors, officials at Parliament, it's been 2 days. Firstly, we are looking for efficient project delivery. I think the last assignment that was done by Mr. Sembokosi underscores that statement. At the end of the day, our quest is to improve parliamentary functions parliamentary practitioners' efficiency. In this case, we want to look at the parliamentary functions as they relate to sexual reproductive health and rights, HIV/AIDS, and governance. We have observed in the past that when sexual reproductive health and rights researchers work diligently, when supervision in parliament is diligent, when staff of parliament and members of parliament are diligent, members of parliament do come to them for advice and guidance. And this is in view for them to perform their parliamentary functions. You know, often when you meet a member of parliament, or it used to be the case, somebody will say, you'll say, oh, do you know Simon? Oh, yes, I know Simon. There's SRHR, the one who does A, B, C, D, F, G. And you'll also hear from Simon that indeed he's overburdened with requests. You'll see Simon reaching out to APHRC, reaching out to others. So we should ask ourselves, why is nobody coming to us in this case? And all of us, we know that this happens when there's a perception in parliament that SRHR and human rights are being adequately addressed. When we see that we are preoccupied, that we get a lot of demands, one is because now we are known. There were instances where in the past, we used to have members of parliament speak against the project. And they were saying it does not exist in their parliament. They don't have an SRHR research. And we're in pains trying to explain that, in fact, this is the name of your researcher. This is when the researcher was recruited. This project is not just being implemented in this country, it's actually in 10 countries. So, colleagues, I think there is need for us to do so. Consistency and diligence are therefore essential skills to be garnered, in addition to your knowledge that you've gained in the past 2 days on budget analysis and sexual reproductive health and rights. Secondly, you also need to be consistent in building a broad sexual reproductive health and rights network that brings partners together at national level under the auspices of parliament. These partners are not for the project. These partners are for parliament and all other staff of parliament. You'll appreciate that there are others who come beyond your scope of operation. There are those who will come beyond your scope of competency. There are others that will come, like this project has done for SADC-PF, where we actually ended up having to deal with elements of risk management, where we broadened our governance frameworks. It is for this reason that the administration wings should not be left out, because we'll learn a lot from that instance. Normally, this is done under the national working groups. I need not repeat that, which act as a steering committee for all project activities, technical support, financial support, and many others for the researchers. All of you have attested that partners will bring value to advocacy. They'll also be able to identify the pitfalls that are there and that need to be filled by the executive. So sometimes, yes, research, but sometimes we have think tanks that can bring that information for us. You may not know that there's a gap in a law that has been dormant. You may not know the attempts that have been done previously, because it is impossible to research everything and know about it, especially at the desk level. So this is the reason why it's crucial for us to process the needs of our parliaments and our country in a coordinated manner from a parliamentary standpoint, and that is the advantage of making sure that you are not the only one who faces the national working group. It is a spectrum of staff across the board, so that the needs and the standpoint of parliament in your country are understood in context. So that at the end of the day, you're not the only ambassador who tries to explain what SRHR is about or what the project is about. There will be a shared understanding across the parliament, and there'll be no misunderstanding. In addition, you must find resource persons who are willing to advise members of parliament on germane and specific sexual reproductive health and right aspects. For instance, members of the academia. You'll agree with me that Professor Govenda's presentation was quite enlightening and goes to the core of your indicators that you report on, which can take you to what is out of pocket and how does it impact on the vote ultimately? How does it impact on representation? You have to also make sure that you don't just speak of sexual reproductive health and rights. And when we look at your national working group, you don't even have one person who's a key population. Just by the representation, you can tell the bias of the national working group. I use key population so that you wake up. It could be any other that you are looking at in your representation. There's no one size that fits all formula on how to build networks. You need to innovate based on your domestic context. You'll appreciate, colleagues, that the example that was given earlier on what happened in Mozambique when we were adopting the 42nd and 44th Plenary Assembly, when we were adopting the minimum standards for key populations. Actually, what happened is that the meeting had to stop. And the members said, because we're disseminating the situation analysis, they said, no, these are not our children from Africa. Can you find them so that we can see them before us? And they must tell us that this research was done and we can relate it to our own children. So sometimes representation goes that far. Some people will tell you they've never seen an SG who's been beaten up by a husband before. I'm talking about an executive. Because we don't come out to talk about the lived realities. It is not research that is based on fake things. This is research based on what we experience in our homes. There are times where we've had trainings and a member of parliament came after and said, you know what, in my family, we've had this child. This is the third time that she was married. Every time the family brings the child back. And you know, in the African context, when you are brought back from a marriage, do you know how embarrassing that is? It is actually a shame for the family. This child was brought back twice. Do you know why? Can anybody guess? Because she was intersex. Every time she's brought back, they do what Mrs. Tabenga was saying. Then later on, it grows back. Then the next husband or wife takes the person back. This is not what I thought when I was getting married. So these things are far-reaching, and all of us have a story to talk about in our families. And I'm glad that even in some of these capacity development, you can find remedy. You can speak to our resource persons and say, look, I personally have this deep hatred for anybody else who's female. I don't want to talk about extreme issues. Do you know that people who cannot tolerate another gender? Am I making it up? Do you know people who cannot stand women or people who cannot stand men? Even in meetings, when a man speaks, sometimes we hear. When a woman speaks, we don't hear. When the man says the same thing that the other one says, we begin to hear. Those are biases. And we must begin to think about those things in context. Thirdly, you must also be diligent and methodological in your reporting. This is the only way that you're going to make progress. Progress done, but without reporting is tantamount to making no progress at all. From a project perspective, from a SADC PF perspective, if this money that we have and we can't report, we'll just be asked to return the money. It's very simple. In fact, they will not think twice about it. So if we receive the money and we don't report, if we hold a project agreement and we don't report, this has very serious consequences to the SADC Parliamentary Forum and the progress that we think we are making. More likely than not, Others will then report on the work that you have done. There are situations that I've gone to conferences and I hear about the progress in your parliament, sometimes in social media, because some people are quick. The work that you do, we don't have it, but it's been reported elsewhere. And I think this is something that we must really look at, because it is important that we must look at some of these issues in a manner that assists us. Colleagues, I'm confident that report writing will therefore be something fundamental in your working processes on a daily basis. And I'm confident that you'll stick to the deadlines set by the monitoring and evaluation consultant, and that the same deadlines will be known by our directors, who will in turn remind the clerks of the deadlines. We report monthly. We send a report on a monthly basis to SEDA by the 27th of every month. Pamela has given them an extension after the month. Sometimes then we have overlaps. But those deadlines are very, very important. Fourthly, remember that you can always come to us for advice on foreign policy on sexual reproductive health and rights. You can write to us on email, or you can WhatsApp, and we'll respond to you in due course. Your clerks of parliament and supervisors are also your allies, and will take up the issues of support at the next meeting with the Committee of Clerks and Secretaries General, which will take place next week on the 5th and 6th, as I've said. We will try to make sure that we respect the wisdom of parliaments. You have been appointed by your parliaments. We believe that it is because there's been thorough consultation and wisdom that we need to bow down to. However, the issues that I've outlined should accompany that wisdom. That is the only way that this project can come alive. Colleagues, I hope to take these takeaways. I hope to give these takeaways for you to take away, along with the diverse and informative presentations that you have received. And thank you, Ronald and team, for translating those through Google. It worked, we became efficient. I wish you good luck. I wish you God's blessings, those who believe in God, in spearheading this project. And I hope that you'll advance the sexual reproductive health and rights, HIV and governance agenda at your respective parliaments. I hope the annals of history will recognize your role in whatever it is that you're doing, and that ultimately your privileged position of being in an arena for policy making and changing people's life will not be forgotten and will not be in vain. Thank you, and have safe travels back home.
Just to say thank you very much. It was a pleasure working with all of you. Have a blessed day. Bye. Lunch is served at 1 p.m. So
Yes, Madam Facilitator, thanks. Lunch is served at 1 p.m. May all SADC PF Secretariat staff please remain behind for a debriefing. Thank you.